The Royal Commission into Violence, Abuse, Neglect and Exploitation of People with Disability is now in session.
Good morning, everybody. Welcome to this, which is the fifth and final day of the 26th public hearing of the Royal Commission into Violence, Abuse, Neglect and Exploitation of People with Disability. This hearing is concentrating on the experiences of people with disability who have been homeless or are at risk of homelessness in a variety of settings. I wish to commence, as always, with an acknowledgement of country. On behalf of the Royal Commission, I wish to acknowledge the Darug people, the traditional custodians of the land upon which this hearing is taking place. And we pay our respects to their elders past, present and emerging. We also pay our respects to all First Nations people who are attending the hearing in person today or who may be following the hearing on the live stream. Yes, thank you. Yes, Ms. Eastman.
Thank you, Commissioners. Good morning, Commissioners, and good morning, everybody following the Royal Commission proceeding, be it in the room or online. So, Commissioners, we start this morning with Georgia Wilson, and she's going to tell you her story and the story of her mother. And then after Georgia's finished her evidence, we'll then turn to hear some evidence from the Quality and Safeguards Commission. It will be the first opportunity for the Royal Commissioners to hear from the new Commissioner, Ms. Mackey, and Ms. Samantha Taylor, who you've heard from on a number of occasions, will return. And then after we've completed the NDIS QSC evidence, we'll then turn to Victoria, and you'll hear from two officials from the Victorian government responsible for the regulation of SRSs and broader housing policy. For those following the proceedings, we hope that we'll probably conclude today around 3 or 3:30. So, Commissioners, I'd like to introduce you to Georgia Naomi Wilson, and she's in the hearing room. And I think the first thing that you need to do is to take the oath.
Ms. Wilson, thank you very much for coming to the Royal Commission to give evidence today. Thank you also for the statement that you've prepared, which each of us has read. We're very grateful for the assistance that you are providing to the Royal Commission. If you would be good enough to follow the instructions of my associate, who is located over there, he will administer the oath to you.
I will read you the oath. At the end, please say yes or I do. Do you swear by Almighty God that the evidence which you shall give shall be the truth, the whole truth, and nothing but the truth?
I do.
Thank you very much, Ms. Wilson. Just to explain where everybody is, you may already know, Commissioner Galbally, whom you can see on screen, is joining the hearing from Melbourne. Yes, she just waved and you waved back. Commissioner Ryan is here on my left.
Hi.
And I'm the chair of the Royal Commission, and of course Ms. Eastman is in the same room, and I'll ask Ms. Eastman now to ask you some questions.
And just before I do that, so Ms. Wilson is also represented, and I'll just ask Ms. Armand to announce her appearance.
Thank you, Ms. Eastman.
Oh, there you are.
May it please the Commission, I, Elise Armand, appear on behalf of witness Georgia Wilson.
Thank you very much.
We've got to do a few formalities. So can I confirm you are Georgia Naomi Wilson?
Yes.
And your address is known to the Royal Commission?
Yes.
And you prepared a statement for the Royal Commission?
Yes.
And I know you've had a chance to look at the statement again, but everything in the statement is true, is that right?
Yes, it is.
Okay. Now you want me to call you Georgia this morning, is that okay?
Yes.
All right. So Georgia, your statement is about your mum, Kay Alice Wilson.
Yes.
And it's about the time she spent in a supported residential service, an SRS.
Yes.
And she passed away on the 13th of April, 2020. She was 65 years old and she was living at an SRS. At the time of her death, she'd lived at the SRS for about 3 months.
Yes.
So before we start, can I express our condolences for the loss of your mother?
Thank you.
We know from what you've told her, you loved her very dearly and she's still in your heart.
Yes.
And today you wanted to make sure that we don't just talk about your mum, but this is her story as well as your story. Is that right?
Yes, that's very important.
And we've agreed that we're going to see how we go. But if any time you need to have a break or you just feel you need to have a sort of moment to yourself, can you let me know and we can do that?
Yep, thank you.
Okay. All right. So before I ask about your mum, can I do a little bit about you? So you're 40 years old. Is that all right to say that?
Yes,
And you live in Victoria
yes, I do.
and you have 5 children.
Yes, I do.
Your eldest is a teenage or 21,
Yes,
but you have a beautiful little baby.
yes.
And your baby's here with you, not in the hearing room.
Yes, she is. Yes.
And you are also a person who lives with disability.
Yeah.
You have an acquired brain injury.
Yes.
And you tell us in the statement how that came about as a young person as a result of a motorbike accident.
Yeah, when I was 2 years old.
Yeah. And you've also had some mental health struggles in your life.
Just around my mum.
Yeah.
Yeah.
And you remember your mum used to say to you that the system doesn't look after those of us with disability, Georgia.
Yeah,
And that's really stuck with you.
it has. Yeah.
And that's one of the reasons why you wanted to share your mum's story today at the Royal Commission.
Of course. Yes.
Okay. Do you mind if I ask you some questions about your mum?
Yeah.
So she was born in New Zealand
Yes, she was.
and she's part Tongan.
Yes.
And she moved to Australia when she was about 22.
Yeah.
And that's because she's a beautiful singer and she wanted
Yes.
to pursue her singing career.
She was amazing.
What can you tell us about her singing and her career as a singer?
She was so gifted and an amazing singer, had an amazing voice. And she really took off in New Zealand and came here to make the big time. And she was almost there. She did a lot of recordings for a lot of artists and wrote a lot of songs that artists have used. And yeah.
And was music an important part of your life growing up?
It was huge. Every day, Mum would have music on every day. Like life wouldn't be the same without it.
And you've still got some recordings of your mum.
Yeah, I
haven't you?
do. Yeah.
So you're able to watch them and listen to music.
yeah.
Does music sort of help you feel better in yourself as
Yeah,
well?
it really grounds me. Yeah.
So can I ask you now a little bit about your family?
Yes.
So your mum had been living in Australia for a few years and she was diagnosed with schizophrenia.
Yeah, she was.
And that diagnosis arose when your brother was quite young, is that right?
Yeah, he was a baby.
And in terms of what you remember about your mum when you were a child, is that she had some struggles from time to time, didn't she?
Yes.
But she was still the superwoman to you.
She was my queen.
Yeah. And you watched your mum over time in terms of her own mental health and it did go down a little bit.
Yeah.
And there was a period where you and your brother had left home, you'd grown up, and you thought she was sort of suffering empty nest syndrome.
Yeah.
But you felt really that for her to be alone was really affecting her mental health. Is that right?
Yeah, I did.
And when you and your brother had left home, your mum changed where she lived a few times. Is that right?
Yes, she did.
So she was lived in different places in Melbourne,
Yes.
and some of them were private rentals.
Yes.
And she lived in some social housing flats.
Yes, she did.
And for a while, she lived in a mental health hostel.
Yes.
And that followed coming out of hospital for some treatment. Is that right?
Yes.
Okay. And then your mum lived with you. So she came
did.
to live with you.
She did, yes.
Can you tell us about what it was like with mum coming to live with you? How many kids did you have at this stage?
I had 4.
4. Okay. So your mum's coming in.
Yeah.
You got 4 kids. How did that all go?
Good. Mum was very supportive. She loved family. She was always around anyway, like regardless of where she lived. helping me and supporting me. And I was the same for her. So we were kind of like two peas in a pod, me and Mum, in the way we supported each other. And she loved it.
Yeah.
She loved being around her grandchildren and, you know, helping me and just being a mum, you know, just being that nurturing, caring person that she was. Yeah.
The house started to get a little bit cramped.
It did. Yeah.
Okay.
So Mum was living with me for about 6 to 7 years. And from what I learned of her mental illness as she got older, it became harder for her to sustain her life in certain circumstances. And one of them was living around my boys who were now teenagers. And she didn't like the ruckus, the, you know, teenage life. And so we had made the decision, so me, my brother and my mother and her mental health workers, that maybe it would be best for her to move into another facility.
So can I jump in at that point? So this was around the time that your mum was in her early 60s.
Yes.
And when she was about 62, 63, she became an NDIS participant.
Yes, she did.
And she had some support workers to
Yes.
assist her in terms of supporting her decision making, but also assisting her in terms of where she might want to live.
Yes.
Okay. And so your mum had made it pretty clear that while she loved you dearly, she needed her own space.
Yeah.
And her idea was that she wanted to live in something that really felt like a home. She didn't want to live somewhere that felt like an institution. Is that
Yeah.
right?
Yes.
Okay. And it was important to her that the doors would not be locked so she could come and go as she pleased and that there was no curfew.
Yeah, that she had that independency that she wouldn't have had if she'd gone to a hospital-based facility.
So she didn't want to go to hospital, so a hospital facility. She didn't want to go into aged care, did she?
Aged care was an option, but because of the NDIS and her still being on disability support pension, we thought that a facility would be more around her needs.
Okay.
Yeah.
Now, at this time, had you ever heard of anything like an SRS?
No,
And had you ever seen an SRS?
no,
And you didn't know, no one in your family had ever lived in an SRS? Okay. But your mum's health workers suggested that she move into an SRS, and you took your mum to have a look at one.
yes.
And we're not going to name the particular place.
Yes.
And you remember her saying, "It's perfect for me."
Oh, she loved
What did she like about it? Purple walls. What else did she like?
She loved it because it was it was close to the city.
Mhm.
And Mum was a city girl at heart. And she loved the big lights and the the flashiness of it all. So and it was close to everything. So amenities and things that she could just go for a walk down the road and she'd be, everything was, and the facility itself, Mum loved her bedroom. She loved the garden. She was really comfortable in that facility.
Yeah. And were you happy about her moving into the SRS at the start?
Yeah, at the beginning, 100%. If Mum was happy, I was happy.
Okay. And so you met the manager of the SRS?
Yes, I did.
And you remember him telling you that your mum was going to have her everyday needs
Oh,
supported
yeah.
while she was living there. She would have 3 meals a day, morning, afternoon tea.
Yes.
She'd have medical care, appointments with the GP who'd visit the SRS twice a week, and assistance with self-care.
Yes.
And he also told you that the residents would be provided with excursions and daily activities.
Yes.
All right. Now, just let me ask you this. Can you remember, in terms of your mum being on the NDIS, did she have a particular organisation that helped her with her supports?
Yes, she did.
And they were different to the people who operated the SRS,
Yes,
is that
they
right?
were.
Okay. But the manager from the SRS said, these are the things that we can do to support your mum.
Yes.
Okay. And your mum was required to pay approximately $490 per week
Yes.
from her accommodation and daily support. And where did she get the money to pay that?
She had a disability support pension.
So her pension was
All
used
of her pension went.
Did you have any money left over
No.
after that? Now, in the statement that you've given to the Royal Commission, you remember the manager insisting at the SRS,
Yes.
insisting on seeing your mum's NDIS plan.
Yes.
And he said to you, it's all about money, money, money.
No,
Why
it
do you
was-
remember that?
It makes me quite sick to talk about this now, because at the time I thought it was some weird, just dark joke of his. But I remember him asking me on the day of my mum's arrival, he said, "Hey, Georgia, do you have the NDIS papers?" And I said, "No, not on me." I said, "They're still at home. Would you like me to bring them?" And he goes, "Oh, yes, they're very important." And I kind of found it strange that they'd be important, since mum had like an NDIS card. She had other things that were NDIS related. And I said, "Why are they so important?" Like, I didn't understand. And he looked at me and he said, "Money, money, money." And he rubbed his hands together. And I thought, that's a bit strange. Like, my mum's not a paycheck, not like, but yeah.
So that conversation you still remember really clearly, don't
Oh,
you?
100%. Yeah.
Now, it was hard for you to accept that somebody else would be supporting and caring for your mum, but you put your trust in the SRS
Yes.
and you relied on what the manager told you about
I did.
what was going to be done to support your mum. I know you feel very guilty about that now. So can I ask you some questions in terms of what happened once your mum moved in?
Yes.
Okay. So you helped your mum move in around February 2020
Yes.
and you helped to set up a room,
Yes.
feeling comfortable. And in terms of being able to contact your mum at the SRS, you were given the office phone number
Yes.
and but you didn't have any after hour number.
No, there was no emergency number or, yeah.
And your mum had a mobile, but she wasn't the best with the technology,
No.
was she? So you wanted to make sure you had a landline number that you can call.
Yes.
Okay.
Yes, I did.
And when she moved into the SRS, there were about 27 other people living there.
Yes.
And your mum was, you thought, probably the oldest person there.
Yes, she was.
But she had her own room
Yes.
and her room had both a shower and a toilet.
Yes.
And she had an emergency buzzer in her room if something happened to her.
Yes.
And the manager said to you, if anything goes wrong or she needs help, she can just buzz.
And he made it clear that someone would be there instantly
Okay.
for her care.
Now, when your mum moved in, did you know how many people actually worked at the SRS?
No, I wasn't. All I was told by the manager was that there would always be someone there 24/7 for the residents.
But over the time your mum was there, you only ever saw two people there, the manager and
Yes.
the cook. Is that
Yes.
right? Okay. Now, not long after your mum moved in, say about a month or so, you started to sort of have some concerns and you went to visit your mum and you took your then 8-year-old and 6-year-old son and daughter with you.
Yes.
And something happened that was quite scary. What do you want to tell the Royal Commission about what happened on that day? And if you don't want to talk about it, tell me, I can do it. But I thought you might want to tell the Royal Commission that.
Yeah. So I'd taken my children that day to visit mum. It was a Sunday. And we'd gone to visit grandma like we normally did. And we were sitting outside in the communal backyard area. Now, in the backyard area, there are two entrances to get to the backyard. One is from where the bedrooms are and the other's from the communal lounge room. And we were sitting outside and my mum had told me that there was a racist resident there. And about 2 seconds later, she'd hunched over and had this really angry, scared look on her face. And I looked behind me and I said, "Mum, is that him?" And he was a guy maybe in his early 40s. And he'd approached us and he looked at my mum and he said, I see you brought your fucking ghetto with you today, Kay. And I looked at this man and I said, what did you say to my mother? And he walked inside through the bedroom area of the entrance. At this point, he'd come back out 2 minutes later and he said to my mum, I'm going to fucking kill you, Kay. I'm going to do exactly what you did to her. I'm going to rape you and I'm going to fucking kill you.
You were absolutely terrified, weren't you?
I was livid. My children were extremely traumatized by seeing this man talk to grandma in such a way. My daughter was screaming. Mum was so calm though. And she said, don't worry about him. He has issues. Take the kids home. They can't be around this.
Yeah. And there were no staff around at the time.
No, there was nobody.
There was a couple of other of the men who lived there.
There were
and
residents there, yes.
And they said, look, we'll look after your mum.
Yeah, so we walked inside and I said, while I was walking with mum inside, I said, where is the manager? Like, where is there anyone here? And the two male residents that told me that they'd look after my mother said, he's never here.
Yeah. You did speak to the manager the next day?
Yes, I did. I called him first thing in the morning.
And the manager told you that the man who had sworn and threatened your mother had been admitted to hospital?
Yes, he
and
did.
that he wouldn't be returning to
Yes,
the
he did.
SRS. So that incident sort of started to be that change for you of, I'm not quite sure this is the best place for my mum, is that right?
Yeah, I said to mum at the time, I said, come home with us.
Yeah.
It's not safe here. And she said, I'm fine. I'm fine. That they'll look after me. And she was referring to the residents there. And she said, the manager will be back. And, you know, I'm fine, I'm safe.
Okay. I want to now ask you about something that happened around the 14th of March. This
Yes.
is about 6 weeks into your mum being there.
Yes.
So around 8:30 at night, you got a call from the cook at
Yes.
the SRS to say your mum had been taken by ambulance to hospital and she was having breathing difficulties.
Yes.
And the cook said that your mum seemed to be okay, but he couldn't, well, she couldn't tell you anything about it. So
No.
you had to then chase up and see what was happening with your
Yeah.
mum at the hospital. Is that right?
Yes.
And you found out that your mum was in the emergency department and on oxygen,
Yes.
and that she had had an obstruction to a cardiac obstruction
She
that had affected her breathing.
pulmonary
Yeah.
obstructive. Yeah.
So your mum had to spend a bit of time in hospital, but
Yes.
hospital's not your mum's favourite place, is it?
No, no.
So she got quite anxious about being in
She
hospital.
did. Yes.
And she actually wanted to get out of hospital and go back to the SRS. Is that right?
Yes.
So when your mum came out of hospital and back to the SRS, did you help her with that sort of move back?
Yeah, with the transition, of course. I
Yeah.
was there first thing on the Sunday morning, the 15th of March. And yeah, I said to the doctors, they said, if your mum refuses to stay here, we can't force her.
Yeah.
So they had told me strict instructions to give to the manager of the facility regarding her ongoing healthcare.
Yeah. So just pausing there. So the hospital said,
Yes.
we can't make your mum stay,
We can't. Yeah.
but if she's to go back to where she lived,
Yes.
she had to be strict on her medication
Yes.
and be supported in terms of when she took the medication.
Yes.
Okay.
And what type of medication it was, that they were going to administer it through an IV in hospital over 2 days. But because mum had refused admission, it could be given to her through a tablet.
So when your mum got back to the SRS, the only person around was the cook,
Yes.
and you wanted the mobile number for the manager so you could give some instructions about what your mum
Yes.
needed
Yeah.
to do.
So I walked up to the cook and she couldn't understand a word I was saying. And she said, go into the office and write it in the manager's diary.
Yeah.
Everything the doctor told you to tell him, and I will let him know first thing in the morning.
Okay. Now, just for many people will remember
Yeah.
the 14th of March and what happened the following week in March 2020 was pretty big
Yeah.
because the country went into lockdown
Yes.
about 10 days later.
Yes.
And one of the real concerns for you was, given your mum's health, returning to the SRS, and the first lockdown starts in March 2020, you were not able to visit your mum,
No.
and all you could do was talk to her on the phone. Is
Yes.
that right? Okay. And so just let me know how we're going if you need a break. You got a call on the 5th of April from your mum, and you said she felt really upset and panicked, and that the SRS manager had threatened her. That's what she told you.
Yes.
And she had been accused of putting sanitary pads in the communal toilet and creating a plumbing issue.
Yeah.
And as far as you knew, your mum was not using any sanitary
No.
pads at
And
age
there'd
65.
already been 2 plumbing issues previous that week. So at this point, the manager was extremely angry with whoever it was that was doing it, but he accused my mother.
Yeah, you couldn't get there to see your mum or see what was going on. All right. About a week later, we're now at the 13th of April 2020. What I might do is just walk through this, Georgia, and if at any time you want to jump in or say anything, let me know. So, Commissioners, on the 13th of April, Georgia says this: shortly after midday, I received a call from a senior constable who worked for police, who let me know that my mother had passed away that morning and I needed to visit the SRS to identify her body. I called Joe, that's your brother, on the way to the SRS. We assumed Mum had passed peacefully in her bed during the night. In this conversation, Joe and I agreed that it would be undignified for Mum to have an autopsy, given her mental health struggles and poor interaction with doctors during her life. When I arrived at the SRS, I was asked by the police to put on full protective gear because we were in lockdown. I mentally prepared myself for the long walk to my mother's room, where I assumed she would be. But immediately when I got inside, the police started saying, "Are you ready?
Are you ready?"
I turned the corner and I could see my mum's body through the sliding door to the back courtyard, lying on the concrete just outside the dining room in the communal area, and she was covered by a tarpaulin. I was appalled. Nobody had thought to move her to a bedroom or to place her anywhere less public or more dignified. Mum had not been respected or dignified by being left on the ground. The police lifted the tarpaulin so I could formally identify her. When I saw her face, she looked like she was in tremendous pain, and I will never forget that look. The police told me she had been found dead at 10:30 a.m. on the backyard couch, which was next to where she'd been lying on the ground. They said the paramedics arrived at approximately 10:45 a.m, but had moved Mum from the couch to the ground to perform CPR. The paramedics attributed her death to natural causes, so it did not need to be reported to the coroner. They explained that I had the option of reporting her death if I thought it was suspicious,
Yes.
but that I'd need to fill out a ton of paperwork if that's something I wanted to do. And I felt completely overwhelmed just after identifying my mother's body, and I wasn't in the right mindset to think about paperwork. At the time, I had no reason to feel suspicious, so I decided not to do that. Okay, just pausing there. Okay.
I just wanted to say that when the police had asked me whether I thought my mum's death was suspicious, I found that extremely odd, given the fact that we were in lockdown. So we weren't sitting inside the facility. I was outside the front on a plastic chair. And the whole environment of it just seemed odd, really off. And yeah, when they said, if you find your mum's death suspicious, we have a ton of paperwork for you to fill out. I didn't know what that meant. Like, what would I have to fill out? What questions would be on it? I didn't know what I, have to do. So I didn't do anything at the time.
I think, Georgia, fair to say you're absolutely in this state of shock.
Yeah.
Yeah. So you had to attend to what happened next with your mum,
Yes.
to organise a funeral,
Yes.
to collect her belongings, and you wanted to sort of sort out what was going on.
Well, Mum didn't have a funeral until a year later when my brother could come from New Zealand.
You've told us in the statement, and you've given us a note, that you got an email from the funeral home.
Yes, I
who
did.
came to take your mum's body. And can I read this? This is how they described your mum. Physically, Kay was very dirty. Dirt or similar under all nails, across hands, legs, neck and face. In addition to Kay's long hair was matted. Kay's clothing was old, stretched. One foot had multiple socks, and there was a hole in the bottom of her shoe. Both her feet felt very wet, and Kay had strong body odour. So, Georgia, that for you, to hear someone describing your mum with that lack of dignity is something that has driven you to do the steps that you've taken, to come and speak to the Royal Commission. And I'm going to ask you about some of the things that you did in terms of taking this to the government regulators to find out what happened. Is there anything you want to say at this point, or just take a deep breath?
At that point in time, I had already put in a formal complaint with the Department of Health and Human Services. But I was going purely on intuition. I didn't have any facts. All I knew was my mum was on the couch, paramedics had moved her and put her death down to natural causes. So when I received that report, that was, that was something else.
Had you ever heard of anybody called the Ndis Quality and Safeguards Commission?
No.
Have you ever heard of that body?
No.
So you did want to find out what happened to your mum.
Yes.
And some of the steps that you took included speaking to the GP.
Yes.
And the GP told you your mum hadn't been taking the medication.
Yeah, and I'd been told that she did take the medication by the manager the day after I'd left the note.
Yeah. You wanted to find out what did the paramedics actually do. So you wanted to get information about the paramedics reports.
Which I did.
Yeah.
Yeah.
And as you said, you raised it with the Victorian Department.
Yes.
And a year later, so we're up to April 2021.
Oh, can we?
Is there anything in between there? Okay.
So, okay. Yeah, so the department were in line in doing a full investigation on the facility in September 2020.
Yep.
And all I had at that point was the doctor's word that mum didn't take the medication and the report that I had from the funeral director.
Okay.
In November of 2020, I received 2 copies of the Paramedics Reports. And on those reports, they both stated that my mother was seen on the ground, not on the couch, deceased for 2.5 hours before they arrived. So she was never on the couch. They didn't move her. That her death could not be determined because of the amount of time she was lying there. So she needed to go to a coroner. I was told she didn't.
So Georgia, it's been difficult for you to actually find out what happened.
Yes, but I had sent these documents to the Department of Health and Human Services, trying to be as transparent as I could be during the whole investigation process.
But it was about a year later, so April 2021, you still hadn't received any formal indication of what enforcement activities might be happening for the SRS, and you had to send a follow-up email.
Yes.
The day after the anniversary of your mum's passing, you got a call from a regulatory officer who told you that the investigation was now closed. And she told you that fortnightly auditing systems have been ordered for the SRS. And the regulatory officer, this is what you say in the statement, the regulatory officer indicated to me that they would have never have known about what happened at the SRS if I did not make a complaint.
Yeah.
I said something like, SRS accommodation is under your umbrella. What do you mean you wouldn't have known? And the regulatory officer indicated to me nothing further could be done by the department and that her hands were tied. That didn't stop you. You sent a follow-up email 2 days later, or that day also. And then 2 days later, you got an email from the department. Do you want me to read what that says?
Yes.
The regulatory compliance and enforcement team investigated your complaint and substantiated the following allegations. First dot point, the SRS failed to notify you of Ms. Kay Wilson's deteriorating condition when she allegedly declined additional support for her care. Second dot point, Ms. Kay Wilson's physical appearance was not adequately addressed while residing at the SRS. The third point, following her passing, Ms. Kay Wilson was covered and left in the communal area at the SRS, and this did not afford her adequate dignity. As discussed, concerns relating to the cause of death or if Ms. Wilson's death was preventable are not within the scope, are not within our scope to investigate. So you got that email. You then try to contact the regulatory officer by phone and email to do a follow-up meeting, and you didn't receive a response to that request.
No.
Has anyone from the government contacted you?
No.
Do you know anything more about what happened to the investigation beyond what's set out in the email?
No.
Has anyone given you any advice about what further steps, if any, you could take?
No.
And has anyone offered any apology to you about the circumstances of your mother's passing at the SRS?
No.
Has anyone from the SRS contacted you to express any apology or provide any explanation?
No.
Can I ask you about the impact of your mother's death and your concerns for the future? And I think you've said to us, Georgia, that you don't want anybody else to be in the situation you've been in. You have felt not only the circumstances of learning of your mother's passing and how you were treated on that day, but also what's happened in that time since. has left you devastated and hopeless that the Victorian government did not do an investigation that achieved better outcomes, and you feel anger and despair that other SRS residents may continue to experience neglect at the SRS. Is that right?
Could I just say?
Yeah.
Yeah, about that. I put all of my trust in that manager, all of my trust in the Victorian government to do what's right. The manager lied, plain and simple. Now, what sort of what I'm trying to get my
That's okay. Well, let me put
what does that paint? What picture does that paint when we as a society put our trust in these people to do the right thing? That's their job and they don't do it. And my mother dies as a result of that neglect.
Now, having known nothing about SRSs, you now know a bit about SRSs.
Yes.
And you've got some recommendations you want to share with the Royal Commission.
Yes, I
So
do.
if you've still got your statement with you and you turn over to about top of page 14, do you want to read these out to the Royal Commissioners or tell the Royal Commissioners what your recommendations are?
Yes.
And I'll get you to just cover what's on. So the Commissioners have got a copy of your statement, but I think people will be interested to hear, what do you think needs to happen?
Yes. Modification of the current regulations allowing for 1 to 30 staff to resident ratio in SRSs. A significant increase should be implemented to the amount of staff required, especially in the case of residents with mental disabilities. A ratio akin to 1 to 15 would be far more appropriate.
Implementation of universal auditing systems for SRSs involving regular audits at a minimum quarterly basis, but ideally a bi-monthly basis. And in each audit, there needs to be a thorough check of the practices of the SRSs and the welfare of the residents. That's the second one. Over to you on the third one.
Yeah. Implementation of a system of audit and accountability for the Department of Family, Fairness and Housing to ensure that any investigations being conducted into SRSs are done so properly, fairly, and with a satisfactory outcome favouring public interests.
And the next one?
Implementation of greater restrictions on access to NDIS funds by SRS managers and care providers to prevent these funds being claimed by SRSs or caregivers who are abusive or neglectful. Thorough checks into practices of SRS managers or a care provider should be conducted before they are granted access to residents' NDIS funds.
Okay. And you've said you think there are many other aspects of the Australian disability system that need to change, but I'm just going to read the final 2 paragraphs and then the Commissioners might want to ask you some questions. My mother's disability did not make her lesser, and she should have been treated as a valuable human being, as all people with disability are. I feel that the SRS treated my mother as a number and a paycheck. Based on my experience, I feel the Australian disability system treats people with disability without dignity, respect and humanity, and the government departments, which are supposed to be there to investigate and prevent such mistreatment, cannot be trusted to do their jobs correctly. This is not right. We need to do better. The administrative system within the disability sector, ironically, doesn't seem to be looking after those with a disability. So who is going to listen to me? So Georgia, thank you for sharing your story and Kay's story, for speaking so powerfully and being a powerful advocate for your mother. I think the Commissioners might have a few questions for you.
Thank you. Do you mind if I ask my colleagues if they have any questions to put to you? Thank you. I'll ask Commissioner Galbally first.
Thank you, Georgia. Look, I just wanted to ask you, do you think SRSs should continue at all with those large numbers. What's your perspective on their going on?
Yeah, I don't think the staff to resident ratio is right, given that in SRSs, it's so broad in the sense of anybody with a disability, be it mental or physical, is allowed to live there, but it's 1 to 30 people. And that is an extremely hard task for anybody to do. It doesn't excuse it, but I think that if we can't do better in that ratio of making more staff present for these people, then why do we have these facilities at all?
Would you have liked other options to have been suggested when your mum wanted to, move out, and for all the reasons you described, like a rental next door or a granny flat or something that might have been more
Appropriate?
Yeah. And no one offered those things, I gather.
No, so my mum couldn't live independently.
Yes, with her NDIS package to help her, yeah.
Well, maybe that could have worked, but that was never brought onto the table. So, but in hindsight, that would have been a great idea.
Thank you very much. And thank you so much for, it was very, very moving. And my condolences too, of course.
Thank you so much.
I'll ask Commissioner Ryan if he has any questions.
Thank you, Georgia, for coming to the Royal Commission. And obviously my sincere condolences on the loss of your mum, who's clearly a special person to the world, given her capacity to sing and to improve people's lives. But look, I just wanted to ask, do you have any idea how your mum came to choose the SRS as an option? Was she able to explore other options? How did she get to find out about it and move there?
So we had about 3 or 4 appointments with her care team to discuss living arrangements and what sort of possibilities there were in the sense of aged care, SRSs, and things like that. And that's how we came to the conclusion of an SRS being more to suit her needs individually.
Who was the care team? Were they aged care providers or were they hospital people? Or
So she was involved with a mental care health team that were providing her support as well as the NDIS.
did she have a support coordinator from the NDIS?
No, not yet, not at that time.
People have come to the Commission, you might have been aware of their evidence, where they describe SRSs as being like dumps, really, that you could smell how bad they were, that they were unclean and unkempt, that there was broken furniture and broken facilities around the place. Would you care to comment on the condition and the hygiene of the SRS that your mum lived in generally?
I didn't really see anything that was hygienically out of sort. No.
And did your mum ever comment on the food that she received?
Yeah, the mum was a vegetarian, so her diet was limited in the SRS. There was only one cook, and so mum would usually just get either soup from a cup or like an egg on toast. That was her dinner on a daily basis.
Goodness.
Yes.
Well, thank you for coming to the Royal Commission. They're all the questions that I have, but thank you for coming. It's an important story and I'm glad we heard it.
Ms. Wilson, I too thank you for coming to the Royal Commission and telling your story and your mother's story. I extend my sympathy to you too for the loss of your mother. I think that you have sought to honour your mother by coming here and telling us of her story, and you have done that. And we're very grateful to you for sharing your experience. I know it's not easy to do that, but you have done that and we've learned from it. So thank you so much for sharing that experience, your experience and your mother's experience with us. Thank you.
So thank you, Georgia. And Commissioners, could we have a short break of about 10 minutes?
It's now just after 10:20. We'll resume at 10:35.
Thank you.
The Royal Commission is adjourned. The Royal Commission is now resumed.
Yes, Ms. Eastman.
Thank you, Commissioners. You'll see that we have with us Samantha Taylor, who has appeared previously at the Royal Commission, and I think for the first time, Tracy Mackey. So I think they've both got to give their oaths or affirmations, and then I'll introduce them and we'll deal with their written evidence.
Yes, thank you very much, Ms. Taylor, Ms. Mackey, for coming to the Royal Commission to give evidence. In your case, Ms. Taylor, thank you for returning to the Royal Commission for another appearance. Just to let you know where everybody is, Commissioner Galbally, whom you can see on screen, is joining the hearing from Melbourne. Commissioner Ryan is on my left. Of course, Ms. Eastman is in the hearing room. If you would be good enough to follow the instructions of my associate, who is located to my right, he will administer the oath or affirmation, as the case may be, to each of you.
Miss Mackey, I will read you the oath. At the end, please say yes or I do. Do you swear by Almighty God that the evidence which you shall give shall be the truth, the whole truth, and nothing but the truth?
I do.
Ms. Taylor, I'll read you the affirmation. At the end, please say yes or I do. Do you solemnly and sincerely declare and affirm that the evidence which you shall give shall be the truth, the whole truth, and nothing but the truth?
I do.
Yes, thank you, Ms.
Thank you. Ms. Mackey, can I start with you? Your name is Tracy Ann Mackey,
It is.
and you prepared a statement for the Royal Commission dated the 8th of August 2022.
Yes.
You might just have to keep your voice up a little bit. You've got a copy with you.
I do.
And I think I just mentioned to you, I am now aware that you have a Corrie addendum to that statement with some corrections to paragraph 58 and 72. Is that right?
That's correct.
All right. I think, Commissioners, you also have a copy of those amendments, so I'm not going to spend time reading them out, but Commissioners, we might include the Corrie addendum in the bundles. So with the combination of the Corrie addendum and the 8th of August, the contents of your statement are true and correct.
That's correct.
Right. Now, I want to just, before I come to you, Ms. Taylor, Ms. Mackey, this is the first time you've appeared at the Royal Commission, is that right?
That's right.
And you have been appointed the Quality and Safeguards Commissioner, is that right?
That's right.
When did you take up that appointment?
I took up that appointment on the 10th of January this year.
And in terms of the 7 months since you've had the role of NDIS Commissioner, you tell the Royal Commission that you've initiated a future state program of work to facilitate the maturing of the NDIS Commission's operations. Can you tell us just briefly, what does this involve?
Sure. So as everyone is aware, the Commission is still a very young organisation, being only 4 years old. And certainly in the first 4 years, much effort and concentration has been on transitioning in all of the jurisdictions, which has been done in a staged way to allow the Commission to build up its capacity and functions, which are outlined in the Act and the rules. And it's now time for us to very much turn our attention to what the arrangements need to look like and how we'll operate as a regulator going forward. So we need to mature our approach as a regulator. And that's something that we're doing in tandem with the sector, who are also newly regulated. So it's a journey that we've all been on. So in terms of the future state, what we've been working on is making sure we've got all the right pieces in place. For example, we've just launched our very first strategic plan, which gives you a sense of how young we are as an organisation. So that was only launched last week. And we've been talking a lot about how we move from startup to scale up, which is how you would expect any organisation to be in its early years. So there's lots of work to still do to make sure that we fulfil all of our functions in the best possible way. And we'll continue to be an organisation very much focused on how we can improve over time the way in which we undertake our responsibilities.
Thank you. And you've set out in your statement, and I won't trouble you with these paragraphs, your relevant professional background, but I wanted to ask you this. Has any of your professional background involved working with the international human rights regime at all and the relevant human rights instruments?
So when I worked for the Department of Families, Human Services, Families, Communities, FAXIA, I can't remember what the acronym stands for anymore. It was quite some time ago.
I might just ask you to slow down a little bit as well.
Okay.
Thanks.
So FAXIA, it was a Commonwealth department. I worked in what was the Office for Women, and we had quite a broad range of responsibilities, including those that related to the rights arrangements internationally.
And as you're aware, the Convention on the Rights of Persons with Disabilities is a core aspect of the work of the NDIS Commission. What's your experience working with the CRPD?
So I've certainly worked in human services for most of my career across all of the different domains, from children to people with disabilities, carers and refugees, and all of those have involved having an understanding of the arrangements around rights. I mentioned the Office for Women work in particular because it was a very strong and probably the dominant part of that work.
Forgive me for interrupting, and my question may not have been clear, but just specifically the Convention on the Rights of Persons with Disabilities, what has been your experience working with that convention?
So in terms of working with that convention, I have worked in the disability space and been on boards that have of organisations that deliver disability services. So I have an understanding of the convention professionally. I also have a brother that has a disability, and he's had that since he was born. He's my younger brother. And I have travelled through life understanding the challenges and the rights that he has, and advocated and worked alongside others to try and ensure his rights. So I have a personal understanding as well.
Are there any particular rights in the CRPD that directly inform the work you're doing in relation to the sort of future strategy?
So there's quite a few, and I don't have the convention in front of me, so I'm not going to reference particular paragraphs. But certainly, as we've been undertaking the work on the future state, depending on what stream of work we're doing, we've been thinking very carefully about rights. For example, in the strategic plan, there are only 3 focus areas. The first of those focus areas is the rights of people with disability. So that is very much framing how we're thinking about our responsibilities and how we're taking forward our role as a regulator.
In terms of using the CRPD on a day-to-day basis in the work that you do, how do you use the CRPD?
I think it depends on the work that's happening. It's quite a broad question. So in terms of how we use it, if we're doing policy work, we're certainly engaging with others and seeking advice about how we would look at the particular conventions and how we would play that out. I've certainly got an active conversation with Mr. Ben Gauntlet in terms of his view on the rights element, and in fact, we're pursuing some work together around that. I also meet with stakeholders, particularly advocates and representative organisations, where a significant part of the issues that we canvass is around rights. And I do meet with participants very regularly. And again, we're certainly engaging in a conversation which is about rights. I would say that we don't just talk about rights in such in the rights, by referring to rights, we talk a lot about choice and control and what that means in terms of choice and control and what expectations people should have.
There have to be choice and control about the content of particular rights, isn't that? You agree with that?
Sorry, so that
It has to be choice and control, not just in an abstract sense, but choice and control with respect to the exercise of rights, the protection of rights, and the fulfilment of rights. You agree with that?
absolutely.
All right. And how or where do we see in the work of the NDIS Commission that connection between choice and control on the fulfilment, protection, choice, exercise of rights?
I think we play that out in a range of levels. So at the policy level, we're certainly considering rights as a very strong input to the way in which we're positioning things, right down to how we're operationalising things. So when we're looking at our internal policies and procedures and the processes we have in place, we certainly think about rights very carefully. And I'd like to give an example of that. So we've just gone through a process with that our complaints commissioner has taken the lead on, where we've looked at whether or not we've got the settings and the processes right about the way in which we deal with complaints when they come in, and also really taking the next step about maturing our processes around intake and then triaging information that we get into the commission.
I might ask you some questions about that in a bit more detail. So in the material...
Sorry, could I just add that the other layer of where rights is incredibly important is the decisions that we're taking as part of our business each and every day. So it's certainly an active conversation and consideration in the way in which we're undertaking those decisions.
Right. So in the material that the Royal Commission was asked to consider for this hearing, there are a number of statements prepared by your predecessor, Mr. Graham Head. Have you had an opportunity to read those statements?
I have looked at those statements. There are quite a number, so I don't purport to be an expert on all aspects of those statements.
And have you been following the proceedings over the past few days here at the Royal Commission?
I followed the last couple of days.
When you say last couple of days, which days?
So yesterday and most of Wednesday.
All right, but you didn't see any of the evidence on Monday and Tuesday?
I did not.
Has anyone briefed you or kept you up to date with what occurred?
Yes, I have.
Okay, all right. Ms. Taylor, sorry to keep you waiting. Welcome back to the Royal Commission. So you've prepared a statement for the Royal Commission, also dated the 8th of August. Have you got a copy with you?
I do, yes.
And you've also provided us a Courier addendum dated the 31st of August, and that makes some amendments to paragraph 39 of your statement.
Yes, that's right.
I think it seems to be just a reference to...
That's right, it's a document.
A document, right. And at the time you made your statement on the 8th of August, were the contents true and correct?
Yes, they were. I have an update though.
No, well, let's just do it bit by bit.
Certainly.
I only ask you, take yourself back to the 8th of August. When you signed the statement,
Yes.
was it true and correct at that time? Now, I understand that you want to give the Commission an update in relation to one aspect of your statement. Is it convenient to do that now?
Yes.
Right, what would you like to tell the Commission, and which paragraph would you like to update?
In paragraph 49, I make reference to 2 confidential exhibits, and I mentioned that that time that I submitted the statement, the action that they relate to remains underway. I just wanted to let the Royal Commission know that one of those matters has been determined, and that involves the refusal of an application for registration.
Right, okay, so, and that relates to the entity referred to?
One of the entities referred
Yes.
to in the confidential exhibits, yes.
All right. Now, you're giving your evidence together, and it may be that there's a question that I ask you that relates to topics that cover both of your evidence, or it might be separate. I will take my lead from both of you about who might respond.
Sorry, Ms. Eastman, just before you
Yes.
commence that process, I notice, Ms. Taylor, that you've now been appointed to the role of strategic advisor.
Yes.
Was there a position of strategic advisor before you were appointed to it?
I don't know that that's a question for me. That might be a matter for the
Or
committee.
did it exist?
No, it didn't.
Right. Well, can someone, I don't mind which one of you, what's the point of a strategic advisor?
So we have, it was timely a number of months ago when we had several significant initiatives underway, one of which is an own motion inquiry, which is the first own motion inquiry that we've undertaken as a commission to look at whether or not we had the resource settings at the right levels. There are, along with that own motion inquiry, there are a number of other strategic pieces of work that we wanted someone at a senior level to take carriage of. And Ms. Taylor was best positioned to be able to take carriage of the work that we anticipated in that space. So she has moved into the strategic advisor role.
Thank you.
I want to start by just ensuring the commissioners can get a little bit of an update in terms of what the NDIS Commissioner has been doing. Mr. Head told us about the review undertaken by Mr. Alan Robertson following Anne-Marie Smith's death and some recommendations made by Mr. Robertson. And he told us with respect to recommendation 4, which was a recommendation that until the NDIS is amended, to provide for the NDIS Commission to establish its own equivalent to state and territory visitor schemes, that the Commission would continue to support the state and territory community visitor schemes. And that was in the context of some evidence concerning the situation in South Australia. Can you tell us what is the current situation in relation to the NDIS Commission with respect to the establishment of a community visitor scheme?
So we continue to work with states and territories where they have an equivalent scheme in place. And for those that do, we have clear arrangements about how we work with each other. I'm conscious that you heard from the Victorian lead of their community visitor scheme yesterday, and certainly we have regular and ongoing engagement.
Has there been any steps taken to develop a national scheme?
There's a review of the National Quality and Safeguarding Framework. That review was due at the end of last year, but will be undertaken, I understand, as a part of the broader NDIS review that the government has indicated it will proceed with. And as part of that review, because the framework includes consideration of a community visitor scheme and those arrangements, they will be considered as a part of that process.
Right. One of the other recommendations which Mr. Head told us about arose from the Safeguarding Task Force report. So that was the South Australian model that indicated that participants and their families are unclear about how to raise matters of concern with the Commission, and the Commission does not routinely undertake proactive inspections to vet the performance of service providers. So Mr. Head told us that some of those contentions were not correct, but I wanted to ask you, in terms of participants and their families having some clarity about how to raise matters of concern with the Commission, what steps, if any, have been taken since the recommendations in the South Australian Safeguarding Task Force report? And if you've got Mr. Head's statement with you, this is the statement from the 14th of May 2021 at page 65, paragraph 265.
I might just have a go at answering that question.
But if you wanted to check it, that's where it comes from.
So there's quite a bit of work underway that has been underway for some time, both prior and after the evidence that Mr. Head gave with regard to that. We have arrangements in place to work with our consultative committee to ensure that the kinds of initiatives that we're putting in place to assist people to be able to make complaints and raise issues with us are improving all the time. We've also funded through grant programs organisations to assist participants and those that support participants to make it as easy as possible and as supportive as possible for them to be able to make complaints and raise issues. And in fact, one of the things that I talk about all the time when I meet with stakeholders is how can we make it easier and what else can we do? We are still seeing a growing number of complaints come in each month. So we know there's still room in terms of people being able to raise issues, and we would always encourage people to raise issues with us.
Were you here this morning when Georgia gave her evidence?
I watched that this morning, yes.
And you heard her say she'd never heard of the commission? You heard that?
I did.
And she hasn't made a complaint to the commission?
She hasn't made a complaint as far as we're aware.
And I'm not asking you to comment on her case in particular, but thinking about her circumstances, would you expect someone like Georgia should know that there is a body called the NDIS Commission?
We would certainly like people to become more and more familiar and comfortable and confident that there is a place for them to raise any issues they might have with regard to the delivery of NDIS services and supports.
Just taking Georgia's example, and tell me if this is the case, does the NDIS Commission have material that's available in, for example, an SRS, which might be a poster? And I think posters is one of the measures that Mr. Head told us about, but just some information. A poster, a brochure, do they exist in SRSs? Do you know?
So there is certainly that information, that collateral available for any service type, and we would encourage providers to make that information available. We've also worked quite closely, particularly for SRSs in Victoria, with the Human Services Regulator in terms of the communication and the information that is available. We've been working quite closely with them for quite some time in terms of that provision of information. The other thing we're doing quite proactively is working with the NDIA about how we can join up and make sure that when people first receive a plan, when they make changes to a plan, that they get joined up information about what to do.
Doesn't that already happen?
So they get information about the plan, but in terms of information from us at the same time, that hasn't necessarily been what has occurred in the past. So that's a really important step to take to make sure people are receiving that information.
What do you think, having listened to Georgia's evidence this morning, would need to be done at a very practical level to ensure people in Georgia's circumstances would even know about the NDIS Commission?
I think we need to continue to do what we have been doing in terms of putting as much information out there as possible, but we also need to make sure that we're sharing information about how easy it can be. So we don't need an enormous amount of information to begin to look at a particular issue. So we do want to build people's confidence that we can actually start to explore and investigate at a very early stage rather than waiting for something to happen. And we're absolutely open to any other suggestions that others might have. In the meantime, we'll continue to work with the range of other regulators, particularly in a jurisdiction like Victoria, where there are multiple regulators that are in the space of, for example,
and I do want to ask
the
you about
residents
that too.
of SRSs. So we'll continue to work with them to make sure that there's information, but we want to try and make it easy for people and not be the ones trying to get a person to determine which is the right regulator. So,
well, they've got to know the regulator exists, and that was the issue for Georgia. She wasn't even at, you agree with it? She wasn't even at the point of deciding which one would I go to. She didn't even know there was a NDIS Commission.
Perhaps I heard a little differently. I heard Georgia indicating that she did go to the Victorian government because that's who she understood as the regulator, and that is absolutely correct.
But not on the basis of there being a choice, knowing you exist as well.
As I indicated, I think it's really, if a participant or their supports support person wants to go to any regulator and make a complaint, we've got really good arrangements in place by which we can refer and make sure that that ends up in the right place if it's not with us. So I just want them to make the call or go online and let someone know that something's happening.
Right, and the next matter Mr. Head dealt with in his statement back in May last year was recommendation 7 of the Robertson report, and that concerned information. So the recommendation was the Commission must at all times be able to know whether a person is or is not an NDIS participant. The Commission should also have readily accessible access to information held by the NDIA concerning what supports a participant is receiving and the provider of such reports. The Commission should not depend on providers to provide it with such information only after a request. So Mr. Head gave us some information about the sharing and the Commission having access to the NDIA's PANDA system, and that the Commission would be able to access that system remotely. Can you tell us what improvements have been made to respond to Mr. Robertson's recommendation 7? And again, if you need to look at Mr. Head's statement, and Commissioners, it's page 69 at paragraph 273. And Commissioners, in your hearing bundle, this statement is behind tab 18. And this might, Ms. Taylor, might be an area for you.
Yes, and just before Ms. Taylor starts, the statement I have from Mr. Head at that time doesn't have a page 73. So I'm not sure I've got the right one in front.
All right. Well,
Just
those who are, so it's paragraph 273. Yes, page 69.
my statement only goes to paragraph 261. So
All right. Well, there's a lot of people in the room and a big trolley of documents, and I'll make sure that you've got the hearing bundles. Okay, Ms. Taylor.
Thank you.
Help me on the information.
So since Mr. Robertson handed his findings to the former commissioner, and indeed in the lead up to that, there's been a considerable amount of work done with the NDIA to give us access to information that they hold about participants and indeed providers on a number of levels. You mentioned Mr. Head's reference to the PANDA system, that is in place and available to staff in a select way, where we're very careful to provide access to information that is necessary for people to verify that someone is in fact an NDIS participant, but also to protect the privacy of NDIS participants by not giving staff access unnecessarily to information about them. So we do have access to that system and our staff use it. We've also made significant changes to our operating system, where we now have a participant view tab, and that allows us to, it uses NDIA data, which is provided to us separately to the PANDA system on a fortnightly basis to data match participant information in our commission operating system with NDIA data, on the basis that their data is the primary information of the source of truth about the circumstances of an individual.
So can I jump in there? So to the extent you've got information through the NDIA, you have to rely on the accuracy of the NDIA's records, is that right?
We validate, we can match across. So we don't abandon any information that we might collect through our functions about an individual. We do seek to validate that information to see if we, can match. And there are data exchanges for the purposes of updating particular fields if that's necessary. It's important that that happens through the moment of a person's engagement with the scheme as a whole. However, often in the course of our particular functions, and I think this is what Mr. Robertson was getting to, we do get information about an NDIS participant through a provider. That provider may provide a significant amount of support to a person or a very small amount of support to a person, we would obtain that information through the record of a reportable incident, for example. We might also get information about a person through a complaint. Now, because anyone can complain to us, and because, as I mentioned just now, a person's engagement with the scheme can be significant or of a lesser nature, we can't always rely on the identifying information or indeed people's assessment through a provider or a complainant who might not be terribly familiar with a person to rely in full on the information they give us about that individual, which is why we have the verification of participant data through the NDIA's sources.
Is the Commission confident that it would be able to pinpoint all NDIS participants?
Well, where they've come to our attention, we did an extensive validation exercise of the participant information that was in our Commission operating system around the beginning of last year when we were doing the matching, and it was very, very strong validation capability. We're pretty confident, yes. And as I say, we retain the record that we have in any case. So if it should arise that we need to engage with the agency to be clear whether or not someone is or isn't. So I mentioned that we get their data every fortnight, for example. If someone were to come to our attention through by approaching us with a complaint or through an incident, and they were not part of the set because they were a recent participant whose plan maybe had not been initiated or approved at the point the data transfer happened, we do have protocols where we can engage directly with the NDIA to just be sure. And and of course, the real-time access to the Panda system is a critical backstop for us to be able to have that confidence.
Okay. The things I need to ask you about today are very much focused on the SRS, but just a few questions about some issues that arose at the early part of the hearing where we heard some experiences of people who have been homeless or at risk of homelessness. And did you follow Lisa Short's evidence earlier this week?
I followed part of it. I can't say that I saw it all.
Right. And so she told us, and I'll just use rounded up figures, that in terms of NDIS participants who identify as being homeless, I think it was for the sort of last calendar year, that was just over 1,000. But combine that with people who identified at the risk of becoming homelessness, it was just over 6,000 people. To what extent do people who are homeless or at risk of being homeless come to your attention? Is it only through a service provider or a complaint? So what's the situation for the Commission in relation to any oversight of people who are homeless or at risk of homelessness?
So I can see the Commissioner would like to say something. So if I can just maybe talk from an operational perspective before Ms. Mackey comments. We don't need to wait for a complaint or even an incident to be aware of a particular person. We get information from the NDIA, and we also might get information that doesn't necessarily come to us as a complaint from other regulators and from advocacy organisations who may have concerns. And we have protocols with the agency to then work through with any regulatory intelligence or whatever it is that you might like to call it, what role we might have in engaging with a participant where there might be an issue with the support or service in the NDIS that they're receiving. And similarly, the agency will consider whether or not there are issues that they need to pay attention to as part of their role in supporting a participant, for example, with an adjustment to their plan to address a particular issue or gap. So those protocols are used every day. From the point of view of a person who is homeless or at risk of homeless, I am aware that the agency does, they do have a flag for risks around.
Does the Commission have a flag for homelessness?
We're developing a flag around participants that are at risk in the context of the Commission's functions. But the NDIA's flag is present in the data that we receive from them. And I mentioned the participant view that we have in our Commission operating system. That includes the NDIA's flag, and homelessness is one factor, or potential risk of homelessness is one factor. There are a number of other personal factors that would be present in that flag. And that the access of our staff to that flag is important when we do get a complaint, for example, about somebody, and our staff can then see in the participant view that there may be information that the NDIA has about that individual, which at a very, very high level, I don't want to give the impression that we hold significant information about a person where we don't have their agreement to hold it, but it is a flag which generally says there are considerations that might need to be.
Can I jump in there? If the flag's there and a participant is either homeless or at risk of homelessness, does that trigger anything within the Commission, either to do a sort of closer look at who the service providers may be around a person with that flag?
It would trigger consideration by our staff when they were dealing with a matter about that person, for example, an incident that might be reported to us, or a complaint that might come from anybody, that there are particular issues they need to keep in mind in dealing with that issue. So, for example, in someone who might be homeless or at risk of homelessness, that might suggest to our complaints officers, if someone were raising an issue about somebody, that there might be more creative ways they might need to take to maybe make contact with that person. For example, we get complaints coming through mental health officers and so forth, who might say, I'm a bit concerned about this person.
Can I just jump in there? I mean, it's creative is one way, but if somebody's at risk of homelessness and the cause of that magnified risk is the treatment of a service provider, is there any system within the Commission that would prioritise a person at risk of homelessness for your urgent intervention? So it's a little bit different creative ways, but actually, like, what do you do?
And thank you for clarifying that in the question, because if the situation was arising because the homelessness potential was the result of an action by a provider who was delivering NDIS supports or services, then that would be a relatively clear matter for the Commission. We do receive complaints about those circumstances. We do receive incident reports about that, where people may be at risk of losing their accommodation because of the actions or indeed even the failings.
Is that cohort prioritised in terms of action in either responding to a complaint or, and I'm going to ask you about the regulatory actions in a minute, but in terms of your regulatory actions, is someone at risk of homelessness prioritised in terms of any steps you can take with a service provider?
So the work I referenced before about looking at how we do intake and triage is to make sure that we've got those settings right, that we're not just prioritising on the basis of particular boxes or flags, that we're actually looking at the circumstances of that person and whether or not there's an imminent issue something that's either already happening or something that's imminent and likely to have quite a significant consequence. So, and we're using that to escalate the activity that we take, putting the person first in terms of making sure they're safe, and in the area where it might be about somebody's change in circumstances that might lead to them becoming at risk of being homeless, then we'll work really closely with the NDIA and where we need to, other service providers to ensure.
If a person is at risk of being homeless because, for example, I'll just take a hypothetical, their service provider says, we're going to evict you or you can no longer stay here, should the Commission be the first place where a person goes for assistance?
The Commission can absolutely be the first place that they go for assistance, and I'm certainly aware of a number of those particular situations where we have acted the same day to try and make sure that that person has a place. And certainly what we do is, as I said, put the person first and look at their circumstances, and then we'll do what we need to do if there's a requirement to look at the compliance and any regulatory activity around the particular provider. But we put the person first in terms of resolving the imminent issue that's there.
So that's a good step into just touching and reminding the commissioners of the Commission's particular functions as a regulator. So the relevant legislation says the Commission has the following functions: core functions, registration, reportable incident functions, complaint functions, and behaviour support functions. The core functions are identified as upholding the rights of and promoting the health and safety and well-being of people with disability who receive supports or services, including those under the NDIS, right?
That's right.
And then other core functions are to develop the policies and the framework to support the regulatory arrangements, so they can be advice, education, things of that kind. Is that right?
That's correct.
I'm not going to read out the whole of section 181E. In terms of the way in which the Commission performs its functions, you have got some statutory requirements in relation to registration and dealing with reportable incidents and responding to complaints. Is that right?
That's right.
And in terms of translating those core functions into something substantive, we write in understanding that the Commission works with the legislation, a suite of policies, which include a code of conduct. So you work with a code of conduct.
Yes.
And a range of other rules, including provider registration and practice standards. So all of these matters together set out the expectations that you have of service providers with respect to the standards that have to be met and the expectations of those receiving services as to what's going to happen in the way in which they receive their services, the quality of those services, and what to do if something goes wrong. I'll try to summarise. If I've missed anything, tell me.
So the two primary regulatory tools are the code of conduct and the registration function. Mm-hmm. The code applies to any provider and any worker, in fact, who is delivering an NDIS support or service.
So that includes both registered and unregistered?
Any person.
So any person.
Any person.
Yeah.
And registration applies to those providers who are registered, and it attracts a range of other obligations. And you mentioned some of the other functions, such as behaviour support and reportable incidents, and those relate to providers who are registered. I would say, though, that we do have a set of practice standards which, while relevant to the gateway of registration and for the ongoing or for making a registration determination, because providers need to be assessed against those practice standards, and then for monitoring compliance against them. They are practice standards which we consider to be a guide available to any provider who might be delivering supports or services, although we, of course, in terms of our regulatory tools for non-compliance, would not rely on them in the case of an unregistered provider, but they provide a good overview about how to deliver a quality support to a person with disability.
So with respect to this core function of upholding rights, promoting health, safety and wellbeing of people with disability who receive supports and services, there's a number of sort of regulatory actions that you can take. Is that right? So one is an investigation.
Yes.
You can investigate. Is there an own motion power to investigate, or does that depend on a complaint?
We have an own motion power as well.
And is the report undertaken by Mr. Robertson an example of an own motion investigation?
No,
that's a different part of your function.
That's a different part of the function. And so we only have one own motion inquiry, and it's underway at the moment. I would say it's not just the compliance actions either, where we have regulatory tools. Some of our best regulatory tools, and you can look at really good regulators, particularly in human services spaces, use education and information and building an understanding within the regulated community of the requirements as really important levers to lift quality and what is delivered. And so in addition to our compliance type tools like investigations and penalty infringement notices and so forth, we also have those other tools.
So investigations is one, compliance action is another.
Yeah.
And in terms of compliance management, does that require a complaint to be made to trigger off compliance action?
No, it doesn't.
Right. In terms of compliance action, you can initiate your own investigations, is that right? To look at compliance issues?
We can, and we also use reportable incidents as another tool or input. But where we have information that causes us to consider whether or not a provider, registered or unregistered, is operating inconsistent with the code of conduct, then that's when we can look at that activity.
Right. So the other stream on the reportable incidents is that there is a requirement for service providers to report.
If they are registered.
So unregistered service providers don't have to report reportable incidents, but registered do. So there's a gap there, isn't there, in terms of reportable incidents?
I'm not sure I'd characterise it as a gap. There are different arrangements for registered and unregistered providers.
Let me just use like an example. Say if a person dies when they are an NDIS participant, that the death of the person is a reportable incident. Is that right?
The death of a person with disability is reported where the death occurs in the course of delivering a support or service. The function around reportable incidents applies to registered providers, largely because of the reasons for the obligation to be registered. So I think it's important to say that there are certain classes of support or activities in the NDIS where a person must be registered in order to deliver those supports. And those in the design of the framework, which as we've given evidence to the Commission before about, was established in the early part of the establishment of the NDIS. Really, the Quality and Safeguards Framework was a policy position determined in 2017 by all Australian governments, and the risk around your registration is really designed to ensure that providers who are delivering support, such as those which require the use of a restrictive practice, for example, or particular new elements of the scheme, such as specialist disability accommodation, require a registration. And there is the reason for that is to require particular obligations such as reporting.
Can I sort of tease this out so I can understand it as a practically? Let's take George's example. So she's told us that her mother was an NDIS participant living in an SRS, and she told us that the supports were not provided by the SRS, but provided by others. So her mother passes away while she's an NDIS participant. Should her death have been reported?
No,
Why not?
not necessarily. The death of her mother, and I have to also, I would really like to extend my condolences to Georgia. That evidence was, yes, extraordinary for her to give.
But why? I mean, her mother's
so
died. She's an
the way the
NDIS participant.
statute, the way the statute operates is that the death of an NDIS participant is reportable to the regulator where the death occurs in the course of delivery of an NDIS support or service by a provider that is bound to report that incident because they are registered. The death of an NDIS participant is also advised to the National Disability Insurance Agency, who in fact receives, although I could not speak to the mechanism, advice about the death of NDIS participants in the broad, because many NDIS participants pass away for a variety of reasons, and do so separately to any engagement they might have with anything that they might be accessing through the NDIS.
So what would have had to have been different in Georgia's mother's case for her mother's death to become a reportable incident under Section 73Z4 of the Act and make its way, that report to make its way to the Commission? What would have had to have been different?
So the Commission receives many reports of through the reportable incidents function of the deaths of people with disability who might pass away, for example, in an accommodation setting while receiving supports in that setting. For example, supported independent living arrangement. In terms of your question about what would have had to have been different in the circumstances for George's mother, the SRS proprietor, or that the business, or indeed any other organisation coming in to provide supports into that accommodation might have been providing her with very significant amounts of support. There would have been a relationship perhaps between the support and her death. That could have been because someone, for example, might have been due to come and provide her with some personal care support and had become aware of her death, and they might then report that death to us.
As I said, I'm not asking what happened in her case, but it just has got a flavour of sort of slipping between the gaps, either because you happen to have that connection with the service provider at the time or you don't. Is there a risk in the current regime of people like George's mum slipping between the gaps?
My understanding is that incidents are also reportable to the Human Services regulator, and that I understand, but I did. Yes, I might need to check this. Includes the death of people who pass away while living in an SRS. Now, where you do have regulators who might have an interest in a particular situation, where that situation might, no one has to be absolutely clear in a referral to another regulator, for example, about having a concern about someone's circumstance. But it's not inconceivable that in that situation, if the Human Service regulator, in being informed of George's mother's death, had some concerns about a relationship between her supports in the NDIS, or indeed a failing in those supports, of course, that they might refer to us a concern, and we would then work with them or work independently to explore those issues.
Right. Mr. Head told us on the 11th of February 2020 in his statement, and Commissioners, this is behind tab 15, page 11, paragraph 52, that the Commission's compliance and enforcement options are as follows. So can I just run through these and check that this is still the case? 1, education, persuasion and compliance support. Still used. Monitoring and investigation. Sanctions, including compliance notices, enforceable undertakings, infringement notices, injunctions, variation, suspension or revocation of registration, banning orders and civil penalties. So does that remain the case? And Ms. Mackey, you've said in your statement that you're keen for the Commission to do more in relation to compliance action. Is that right?
That's correct.
And in terms of the way in which you can exercise the powers to give effect to it, the Commission also has powers under the Commonwealth Regulatory Powers Standard Provisions Act. Have you heard of that?
Yes.
And that allows the Commission to exercise a range of powers, including obtaining warrants. Is that right? And also being able to enter premises.
Where we go through a process to be able to do that. We don't have a power of entry as a regulator.
So, so have you ever had to take steps to get access to enter a particular premises?
I believe we have.
Yes, we have.
Ms. Taylor.
Yeah, we've exercised those powers.
And part of an approach to a compliance action is the recent development of the NDIS Commission compliance strategy, supported residential services in Victoria. And you've both got a copy of that. And the Commissioners, you should have this behind tab 7 in the bundle. So, Ms. Taylor, is this a product of the work that you've been doing?
Yes, it is.
And would it be your view that there really is no place for supported residential services in Australia for people with disability? Would you have reached that conclusion?
No, I have not reached that.
You haven't. Is it your view, or have you reached the conclusion that the SRSs in Victoria need significant improvement for them to be safe places for people with disability to live?
I haven't reached that conclusion because I don't know enough about the 100 and however.
117?
I understand that there's a different number, but
that's what's in your document at page 6.
The point in time of an evolving strategy. And I understand action's been taken to close a couple, perhaps more recently, but I'm not aware of the full spectrum of those facilities. I'm not aware personally of any particular issues apart from those issues where we have been working with the Human Services Regulator, or where we, through the normal course of our functions, have issues raised.
Should you know more about the SRSs?
Well, so if I can maybe contextualise this strategy, it is clear that there is the reason for this strategy document, which is it's an internal document which is designed to really guide our staff in their engagement with others, and the Human Services Regulator is one, the NDIA is another, and the Public Advocate in Victoria is also a very significant connection for us. That there are clearly issues that create the potential for risk.
Right, so can I take you, it's page 5 of the document. The NDIS Commission is aware of and responding to the following types of issues impacting NDIS participants living in SRSs. The first one, financial exploitation, where the SRS operator uses NDIS funds, as well as the payment already made by the resident from their pension, to pay for the same supports, or provides no services after depleting the person's NDIS plan. That causes a concern to the Commission, does it not?
Well, that's why it's referenced in the strategy. Can I just say that these are examples in the strategy of issues that we have received through complaints or other intelligence.
Yeah.
And that does not relate. You've asked me a couple of questions which are about SRSs in the broad. And I feel it's important to say that these are issues that have come up, not necessarily, and certainly not in our understanding about SRSs in the broad.
Another concern is trading of residents between SRSs or entities associated with SRSs, where the value of their NDIS plan makes these residents, and these are your words, lucrative for unscrupulous operators. And that includes relocating residents to private accommodation, which does not have the oversight of the Victorian regulator. What happens with those NDIS participants? Do you treat them as having the flag of being homeless or at risk of homelessness? Do they trigger off some particular flag for the Commission?
These are examples of issues that have come to us through our complaints function as allegations or issues that have surfaced around SRSs. And this strategy is designed to make sure that our staff understand the particular risks that may be present for residents of SRSs.
The third one is complex business networks.
The witness hadn't finished, and Ms. Mackey may have wanted to say something then, Ms. Eastman.
Well, what I might do is I'll read through all 7, and then if there's something that you want to say that's referable to the point, we'll do that. So the first is financial exploitation. The second is trading of residents between SRSs. The third is complex business networks established by SRS operators to operate collectively, providing a range of supports and services and duplicating costs already met by a participant where the relationship between these businesses is not transparent to a resident. The fourth, poor or non-existent record keeping by SRS operators, and that results in a lack of transparency. It also limits the information available to regulators. Fifth, residents being limited in their choice of other providers and the ability of other providers to deliver supports in SRSs, or significant conflicts of interest between SRS operators and other providers involved in the person's support. Sixth, coercion of residents, particularly those at greater risk of such practices due to cognitive impairment. And seventh, the lack of skills and competency of the SRS workforce to deliver NDIS supports and services to the level required by residents. And in terms of the NDIS participants who live in SRSs, 30% of all SRS residents are NDIS participants, and your data indicates that they are disproportionately, in terms of the general cohort, people more likely to have psychosocial disability, intellectual disability, and 11% of that group of participants have acquired brain injury or stroke. So when you look at the cohort of the NDIS participants who live in SRSs, would you agree with me, 30% is a very substantial component of all SRS residents?
Absolutely, that's why I have a strategy.
And those,
Can I just...
Sorry,
Yeah.
I do think that Ms. Mackey wanted to say something, so we'll give her the opportunity to do so.
Thank you. I wanted to say that the contextual piece that Ms. Taylor was referencing is actually quite critical in this. We started the evidence earlier this morning by talking about rights, and what we're very conscious of as a regulator is that participants have a right to choose. And so while we might have views, and I heard views expressed yesterday about whether or not people should be choosing an SRS, people do choose SRSs. And a range of those SRSs, like we're making a leap from, there are issues with some of them, and we could look at any other accommodation types and find very similar issues across all of those accommodation types. So I don't think it's fair and reasonable to suggest that because this exists in one part of the SRS sector that we should be making a significant jump into a sense that all SRSs operate in a way that is unscrupulous and
I'm not suggesting that.
of the participants.
I don't think anybody suggests.
I'm not suggesting that, but Ms. Mackey, you say in your statement, living in an SRS may be attractive to some participants because SRSs are regulated under the Victorian SRS Act and overseen by the Victorian regulator. What's your evidence to support your opinion that living in an SRS may be attractive to participants because it's regulated under Victorian law?
So
That's paragraph 52 of your statement.
I had an opportunity to talk to an SRS resident. I wasn't seeking out an SRS resident. I was actually visiting an employment service, and in the course of having a conversation with her, she was very open with me that she lived in an SRS, and she chose that quite well before the NDIS Quality and Safeguards Commission was in place. And part of the reason why she indicated she chose that is because the government she didn't use the word visibility, the government looked after her in that. So she, that was certainly part of the decision making. And we're conscious that there are a range of other accommodations.
You're talking about someone who made a decision before the NDIS came into force. What's that got to do with what we're currently?
But before the NDIS Commission was established 4 years ago.
What's that got to do with our current discussion?
So
of course, she would want the Victorian government to be the regulator. There was no other option.
Mr. McKay, isn't the issue?
Sorry, would you like to answer that?
I was just picking up on the point that
all right.
Ms. Eastman was raising in terms of.
I suggest perhaps we just continue with Ms. Eastman
Right.
at the moment, but I'll have some questions.
So we write in understanding that the opinion you expressed in the first sentence of paragraph 52 is based on speaking to one participant?
No, it's not.
Or what is the other evidence other than the one participant that you say living in an SRS may be attractive because it's only regulated under Victorian law?
Because there are a range of other accommodation types that don't have the protections that are afforded to those residents in SRSs. So SRSs in Victoria have a process around registering, and they have a regulator, and I'm sure you'll have lots of questions for the regulator about how they're regulating, but they do have a regulator and they do have oversight. So it's helpful that there is another layer of oversight that doesn't exist in other accommodation types.
You also say in that paragraph, equally, participants who have resided in an SRS may be more comfortable remaining in this style of accommodation as it suits their preferences and needs. And what's the basis for making that statement?
We know that participants make choices about their accommodation for all different reasons. We've heard from a number of lived experience witnesses that I've heard in the last couple of days where they've made choices about where they've chosen to reside based on, for example, their congregate style of living in terms of not being isolated and alone, the level of support that they get because they need some supports with daily arrangements. There are a whole lot of reasons, and that is consistent with what we hear from participants. They make choices. There are also there's something to be said around the referral patterns from a range of other mainstream services and a range of specialist services into SRSs as an option for people who might require those types of supports.
In terms of the risk to NDIS participants, your strategy identifies a number of risks to those participants, does it not?
Yes, it does.
And those risks are specific to life in an SRS as opposed to different forms of accommodation, is that right?
I would say a number of them are not specific to SRSs. We see that in a number of other services that are supported and accommodation options that are delivered.
One of the risks is the similarity between supports provided by the SRS and the NDIS make the boundaries between these systems unclear and unduly complicated for residents to navigate. That's quite SRS specific, is it not?
Absolutely. That's why I just mentioned that some of them are applicable in other service types, not all.
If there is a lack of clarity in the boundaries of the different regulatory systems, and thinking about the cohort of the NDIS participants who live in SRSs, that creates a significant risk for those residents, does it not?
If I can just maybe address that question. But first, just make the point that there are a number of circumstances in which the supports that are delivered in one system and those that are delivered in the NDIS overlap or might be unclear. And this strategy, I think, if I recall, makes the point that the navigation between those systems should not be the responsibility of the person with disability to navigate. Residential aged care, of course, where we do have a number of NDIS participants living in residential aged care facilities is another example. And I guess in both situations, this one and in that similar situation of residential aged care, the references Ms. Mackey was making earlier about the way in which we share information with other regulators and determine between us who is best placed to take action, depending on the nature of the circumstance that's arising for the person is...
Could you please state very succinctly the point you're trying to make? Because we're taking quite a long time to get to the point. Can you just tell us what it is you're trying to say?
I don't think it matters. Where there's more than one regulator involved, it's a matter for us to determine who is best placed to take action. That's the point I'm trying to make here.
But isn't the point that while there are two regulators deciding who's going to take action, that the person whose rights and interests are part of your core functions can slip between the gaps? That's the risk, isn't it?
Well, it could be a risk if we take too long, but in the circumstance where we're working with someone who might have complained to us that they think they've paid twice, then we'll work on that and engage with that person without having to wait to determine whether or not the human services regulator is going to do something. It's much at the pointier end I'm talking about. It doesn't stop either of us delving into issues with that person, working with that person, or trying to resolve the issue between that person and that operator.
Your strategy says that the lack of clarity exposes residents to risk from unscrupulous operators who may continue to charge residents for supports that they're funded for by the NDIS, but also overlapping. That's what you identify the risk, unscrupulous operators.
Well, it would be unscrupulous of someone to deliberately do that, absolutely.
If the operators are not only accommodation providers, but they are also registered or unregistered NDIS service providers, that's an area that you can take action, is it not? If they've not done the right thing. I mean, I did hear part of the evidence from Wintringham the other day, for example, where they're an SRS operator, they're delivering NDIS supports as part of their business, and they're quite clear. So we would, if someone was concerned about that being an issue and there was a lack of clarity about how that operator was describing or delivering those supports, then yeah, absolutely, we would pursue that and seek a resolution to it. There might be situations like the evidence given by Wintringham where it's completely transparent and not something that we would have a concern about. All right. The strategy says it's not reasonable for the residents of SRSs to have to navigate this complexity without assistance to understand their rights and guidance on where to get help and when they require it. I asked you earlier about what the Commission does to provide information to people in the SRSs. And I asked you whether, for example, you have posters or the like. Having identified this as part of your strategy, what does the NDIS Commission do to address navigating the complexity so residents understand their rights and they have guidance on where to get help when they require it?
If I can start on that, one of the things that we are doing is visiting a number of SRSs, our Victorian team, is going to a number of SRSs, starting with those where we think there are issues. We might have had a complaint from someone, or we might have had a referral from the Office of the Public Advocate to talk to residents to help them understand that we're there. And they will do that sequentially as part of this strategy, and have been for many, many months, to make sure people are aware of our existence if they need us, and what we can do to assist them. And we also have a broader campaign that's accessible for people with disability, our Speak Up campaign, which as Ms Mackey said, we have collateral that can be provided to residents to help them know how to get in touch with us.
Is this part of what's on page 9 of the strategy under the heading proportionate to risk, to continue on-site visits activities by NDIS compliance officers to target SRSs with a higher risk factor, and the progress and expansion of education activities?
Yeah, in part, yeah. I mean,
so sorry, can I ask you, are they directed to the SRSs as providers, or are they directed to the residents to understand their rights?
They're directed to both. It's important that we engage with residents as well as with proprietors, so that they are aware that, for example, if they're not a registered provider contemplating delivering NDIS supports or services, that they understand what obligations come with that, and what we might be wanting to talk to them about if we hear concerns about that.
Looking at the regulatory approach that's set out at page 8 and following in the strategy, are we right in understanding that the regulatory approach is to use all of the tools available, but is it fair on my reading to say that the emphasis seems to be very much on building capacity in this sector, so improving the services rather than a compliance model of imposing sanctions or suspending or cancelling registration?
A significant avenue that we go down all the time is to try and improve quality. So we do want to take a proactive stance in terms of going into particular sectors, particular service types, and trying to get a lift in the quality of what is delivered in those supports and services. Until we do some of this work, we won't have a good sense of what type of compliance action we might take. So we haven't got, for example, any targets in here about what type of compliance action we might take, because we need to look at what we learn going in and out of services as we get more information from participants, and then that will inform any compliance action that is required. So it's not that there won't be compliance action and that's not the focus, it's that we can't determine what that is before we've actually focused in this way.
The Royal Commission asked you in the preparation of your statements the number of times any specified compliance or enforcement activity was undertaken by the against an NDIS provider or an SRS proprietor or an entity associated with an SRS proprietor. So you recall we asked you that question?
Yes.
Ms Mackey, you've answered that in various places between paragraph 40 and 45. Tell me if my understanding is correct. There has been one suspension of registration. Is that right?
Well, we haven't prepared the information in that way in terms of
I know, and what I'm trying to do is, having read your statement, to distill what I think to be the compliance actions taken. So one suspension of registration, is that right?
Could I just object at this moment, just because the question at the moment, Chair, doesn't take into account the definition captured by the notice issued by the Royal Commission and the reference to that in Ms Mackey's statement a bit earlier than paragraph 42. I think it appears paragraphs 35 to 37.
Have a look at your statement.
Sorry,
Heard Ms Morgan,
let me
if
have
you
a
want to read what's there.
Sorry, just let me have a look at that.
Chair, I'm trying to distill what's actually happened in terms of the numbers of things.
Yes, I rather thought that Ms Eastman wants to ascertain what the actual position is. I'm not sure definitions necessarily come into it. So if the questions can be framed by reference to the actual action as Ms Eastman identifies the action in her question, we should be on reasonable.
Let's do it this way. There have been no banning orders made, have there?
So
Could I just,
can't-
I'm sorry, Chair, could I just,
Well, it can't have it
Explain.
both ways.
Sorry.
could I just
thinking of-
explain?
Yes, Ms Moore.
Yes, thank you, Chair. Ms Eastman introduced this line of questions using a defined term. And
Which is?
it's just gone off the transcript, but it's the entity associated with an SRS provider, which is a very broad definition in the notice that was issued. And if the question is more direct about an SRS provider as opposed to an entity associated with an SRS provider, I think Ms Eastman will get the answer that she's looking for.
I thought,
I'm
I
asking
thought Ms Eastman was doing that as a matter of precaution, but no doubt she can narrow it in the way that you have suggested, and we'll get to the point.
Thank you, Chair.
All right. So paragraph 40 of your statement, Ms Mackey, you talk about a suspension of registration.
yes,
There has been one suspension of registration that you have identified for the Royal Commission. Is that right?
in the time period specified.
Yes.
And at the point of drafting the statement.
Now, that
Maggie,
suspension,
you don't need to look at your counsel in order to answer the questions, all right?
in terms of that one suspension, that was in relation to Grace Disability Services. Is that right?
That's right.
And Ms Taylor, you have dealt with the chronology in relation to that matter in your statement,
Yes, I have.
and the suspension was overturned, was it not, following a review?
There was a decision by a delegate in the commission to suspend an entity, and that entity, Grace Disability Services, and that entity, after the suspension period had ended, under the Act, the Commission can suspend an entity in its registration for a period of up to 30 days. That suspension period had ended. The entity sought a review of the decision to suspend, and the reviewer decided to uphold the review.
And what was the reason the reviewer upheld the review?
So in my statement, I set out what I understand to
I
it.
don't want you to go through this,
Okay,
just go straight to the punchline on it. There's a
Sure.
reason. You've
Um,
said this if you want to look at paragraph 39. You've said the essence of it. What was it?
It was because the entity that had been suspended was not the entity that the Human Services Regulator had taken their action on, and the decision to suspend was an action related to a registered provider who had a very close affiliation with the entity that the Human Services Regulator had taken action against, and was intended to be protective in that context.
Why did the Commission suspend the wrong entity in the first place? Why did that occur?
Well, I don't think that I
Question.
agree that the
Sorry, stop.
Chair, I just object to that.
Why?
What does that mean, the wrong entity? I'm just, the entity that the HSR identified?
I would have thought it meant that the Commission obviously intended to suspend the registration of an entity that was responsible for certain conduct. On the appeal process or review process, someone decided that the Commission had actually directed its attention to a different entity. That's, I think, what Ms Eastman was asking. Why did that happen?
And that was not the way it was put, Chair. And if the matter had been put.
Let's put it that way.
Thank you, Chair.
Thank you, Chair. I'm grateful for the assistance.
So the entity that was suspended was an entity that we registered, and of course, you can only suspend a registration of an entity that is registered. but had very close affiliations with the entity that the HSR had taken action against. I do think it is unfortunate that the suspension didn't make that relationship clear. My understanding in the review was that the decision was taken to uphold the review because it had not been made clear in that suspension that the reason was that it was a related entity about whom we had concerns about continuing to operate because of the nature of the findings of the HSR. That was an entity where the key personnel were the same as the entity that the HSR had taken action against. It was also an entity which had, as part of its registration, the SRS as an outlet within its own registration. So whilst I think there were certainly issues with the drafting of that suspension, the intent was the right intent, which was protective in the context of an entity that we had a registration over.
All right, thank you.
All right. Now looking, Ms Mackey, at your paragraph 41, are we right in understanding that of all the points raised there are 11 references to conducting an investigation or undertaking or having completed compliance activity, compliance monitoring activity, compliance and investigation activity? You use a range of different expressions. I want to bring them together. So 11 references to that.
I haven't counted them, but I understand that would be about the number.
All right. And in terms of those 11 areas of activity, have they focused on 11 different providers?
So they're focused on different entities, and this is where we had quite a bit of trouble pulling this together because we don't have a fulsome view of the related entities in all cases.
Why not?
So,
Sorry, let Ms Mackey. Yeah.
so, for example, you asked about banning orders, and in the questions that came to us for this submission, you asked about related parties, including family members and so forth. We don't necessarily have visibility of all of the workers in an SRS and all of the family members related to those workers, and understand whether or not we've actually banned a related party who may or may not have been involved in that particular SRS. So it's very difficult for us to draw a line on who isn't and who isn't a related party, given how broad the definition was. So what we've provided you is where we are certain it is an SRS. We have given that information.
Why don't you have this information?
I don't think it would be fair and reasonable for us to understand the family relationships of every employee in all services, for example, and that there's a range of examples that we could give in terms of the way in which the definition was very broad. And
Don't you need this information to be able to discharge your functions and exercise the powers that you have in relation to compliance?
Yeah.
We certainly do need to understand affiliations to a degree, so we spend an awful lot of time and have very good intelligence networks associated with our registration function, as well as those that emerge through investigations that we undertake. I think what both Ms Mackey and in my statement are referring to is that in the definition, whilst we could tell you that none of the actions that are on our public register, for example, relate specifically to an action related to an SRS, we could not, in all honesty, using the definition that the Royal Commission had provided us with, guarantee that those actions, although not related to SRSs, did not relate to a person who was not, for example, related to a worker in an SRS. It's simply
doesn't this, in a sense, invite the very people you describe as unscrupulous SRSs to actually set up arrangements and organisation in the way they organise
No,
their
perhaps
business
I haven't
that slips
explained
through
myself
the
very well.
regulatory
Can
scheme?
I give you an example, perhaps, to illustrate the complexity for us in our statements? But I would like to also go back to the issue of networks. A relative or spouse of any person who would be captured by the definitions above, for example, where a person who is an employee or a contractor of an SRS proprietor, to know whether or not someone was a relative or spouse of someone who was a volunteer working for an SRS at any particular point in time would not be intelligence that we would gather on a regular basis. And I don't think, in all honesty, would come to the issues that I think you're wanting to hear from us. We're simply trying to illustrate that in that definition, that created a complexity for us. If I can go to the second thing that I said I would about networks and how important they are to us, it is incredibly important for us, and we do actively, throughout most of our functions, maintain records and go down paths to identify where there are affiliations between entities that may be registered or not registered, or other businesses as part of our daily work. That can occur in our registration. So, for example, when we register or when an entity seeks to be registered with us, they are required to give us the key personnel that are associated with that the entity seeking to be registered. That what a key personnel is defined as is set out in our rules. Our staff look through ASIC, a range of other records, other regulators' records, to ascertain connections both within our systems and in other regulator systems about those individuals. We connect and we maintain that information for the purposes of connecting up with our investigations. It's very rich information. We even go so far, can I say, of when we might seek further information around a registration or in the course of an interview, we might seek references, for example, and we look for affiliations with referees. So our regulatory intelligence function is incredibly broad, but I think our difficulty as witnesses here today to give the Royal Commission an absolute guarantee about how we maintain information about, for example, a relative or spouse of a volunteer in our SRS is simply not possible, and not the nature of information that we would ever hold as a regulator.
Well, Dr. Pearce said yesterday that there are now, what she described as sort of pop-up SRSs. So they may not be registered SRSs, even if they're required to be, and that there may be NDIS participants living in these pop-up arrangements, but no one is able to get in them, I think was her expression, to actually check. So I'm asking you these questions in terms of understanding what type of information you collect, so that if they are these elaborate structures or that they're going under the Victorian regulatory arrangement, what is the Commission's responsibility?
Well, again, our responsibility is about NDIS supports and services, and
so if something was to occur in one of those other pop-ups that Ms Pearce referred to, we could certainly look into that, treat it like we would any other accommodation type. So the fact that something is an SRS for us isn't a defining point. What we're interested in is whether or not the safeguards and quality of supports and services that are being delivered to the participant is in place, and what we need to do to assure that. So we're quite agnostic to the accommodation, whether or not someone's living in their own home, right through to living in some kind of.
Can we just go back to something fairly basic? Do I understand from your evidence that the concept of a registered NDIS provider, as far as you are concerned, is the corporate entity, assuming there is a corporation, that provides the services and applies to be registered as an NDIS provider?
Yes, and
sorry, the answer is yes.
Individuals can also register. I just wanted to.
Sorry?
Individuals can also be registered providers.
That's my point.
Yeah, okay.
What do you do about the individuals behind the corporation? In the old language of corporations law, behind the corporate veil. What do you do to ensure that the actual individuals who are using these corporate entities, and they may be using many of them for all sorts of reasons, some legitimate, some not. What do you do to make sure you capture them?
So we do capture the individuals, and that's part of the registration process. As Ms. Taylor was mentioning, we collect quite a lot of intel around not only about the entity, but also about the individual.
Do you require them to be registered as NDIS providers if they are, for example, directors, or if you had sufficient information to make the judgment, shadow directors of a corporation?
Yeah, so they're part of the consideration of suitable persons when we look at the registration. So we do look at the individuals, and the registration will not occur without looking
The
at
registration of what or who will not occur?
So it could be an entity, so it could be a corporate entity, or it could be an individual.
No,
So an individual.
I'm not sure, either I haven't made myself clear or you haven't followed me. If a corporation applies, because the registration depends upon an application being made, correct?
Yes.
If a corporation applies, I understand that you seek to find out who's the director or directors, and you make some inquiries about the suitability of the directors. I understand that. Do you also seek to have the directors registered in their own individual capacities as service providers?
No, we do not. The
Why
Act does
not?
not. The Act does not require that. The Act
Does it empower that?
no. The requirement to be registered is in certain situations that are set out in the Act and rules.
I'm looking at them, and it's not obvious to me that it doesn't require it, because an NDIS provider can include someone who provides certain services. It all depends upon what you mean by provide. But if someone who is an individual who happens to be a director or an employee of a corporation is actually providing services, albeit through a corporate entity, that person may well require registration, at least as I read the Act, in order to operate within the framework of the NDIS Act. Has anybody thought about that?
If they're operating independently of the corporation or the entity that's registered, even if they're affiliated with it, then and they're delivering supports to people whose plans are managed by the NDIA or.
I'm not talking about necessarily operating independently, even as part of a corporate entity. Has anybody looked at whether that person may require to be registered?
Well, it's certainly not my understanding that the Act requires that, Chair.
No, maybe someone should have a look.
Just a couple of final things. I'm conscious of the time. You've told us in your statement, Ms. Mackey, since the 30th of June this year, there have been 4 refusals of registration. And are you able to assist us in terms of the circumstances without identifying? So 4 refusals of NDIS providers that are also SRS providers. Is that right?
At the time of drafting this submission, it was correct.
And
I would have to take
since?
on notice the details around those refusals.
And since the 30th of June, the Commission has commenced compliance and enforcement action against 2, what do you describe as relevant service NDIS providers. Are they also SRS proprietors or operators, or are they NDIS providers who provide services to participants who happen to live in SRSs?
They are either SRS operators or have a relation to the SRS operator.
All right. My last question is this: you can receive complaints from anyone, can't you?
That's right.
And some of those complaints can be from family members who may have lost a family member who's passed away or has suffered an injury. Is that right? And the nature of the investigation and action taken can be to impose, for example, some sanction on the service provider.
That's right.
To what extent do your powers extend to requiring a service provider to make redress to either the individual participant or the participant's family members? If you need a definition of redress, I'm happy to go into that, but you understand what I mean?
I do understand what you mean. And what I was going to say is we have a number of parties that are speaking with us at the moment about whether or not our powers extend in that way. So we're currently considering, it doesn't immediately appear so, but we are looking at whether or not there is any room in that space.
Do you have a view on that? Whether the NDIS Act empowers the Commission as part of its compliance powers to order a service provider to make redress?
I'd like to consider the information that we've got being gathered and developed at the moment before I have a view.
If I could add to
Yeah.
that, they're not in the circumstance that you just described, a death, but the complaints powers are quite strong, and in the course of managing a complaint where it's clear there are issues where a provider needs to redress is one.
I'm only on
might be
redress.
another.
I'm not
Then-
talking about
yeah,
improvement, but
then-
just redress.
then we have used powers, though not to the level of that, to get people a compensation for a wrongdoing. So we've used those powers quite effectively for good outcomes for people where they've sought something similar.
Ms. Mackey, would it be your view that it would be preferable that there be an express provision in the legislation to enable the Commission to require a service provider which has not upheld the rights of a person with disability who's an NDIS provider, that you can require the provider to make redress in whatever form might be appropriate?
I'm not sure at this stage, given the work that we're doing, whether or not that's required.
But
There might be.
an amendment to the legislation to make it absolutely crystal clear that the Commission has the power to do that, that would be of assistance, would it not?
I'm certainly not in favour of us continuing to make the legislation any more complex than it already is. I'm very conscious of the participants, and many of whom really want us to simplify rather than make more complex the arrangements. So
Well,
it's not my immediate view.
Where then do participants and or their families go to seek redress if their rights as NDIS participants have not been upheld by the conduct of service providers? Where do they go?
As I said, we're currently looking at that issue, and as soon as we have more to say, we will say more on the
But
matter.
where do they go now? So if they're not with you, where do they go?
So I am aware that there are parties that have taken legal recourse in terms of the provision of services and supports to either themselves or those that they're related to.
Thank you, Commissioners.
Thank you. The document that Ms. Eastman has been asking you about, that is the NDIS Commission Compliance Strategy, SRS Services in Victoria, that is an internal document, as I understand it. It bears a date or a version date as at July 2022. When was the first iteration of that document prepared? Do you know?
There was a first iteration. So there's been a series of iterations earlier in this year. I couldn't give a date, Chair, but there were some draft documents given to me.
But the first iteration was sometime this year, 2022.
Yeah, yes.
All right. Oh, that's all I need to know at the moment. And what prompted that document to be? What prompted the preparation of that document?
I think in my evidence, I'm talking about the fact that I'd had conversations, and we've been talking within the organisation because we'd seen a growing number of issues coming to us through complaints and in our engagement with the HSR about the need to have some more targeted attention around SRSs. That was that kind of came to our attention, can I say that around the time of the major outbreak in Victoria in 2020, the COVID outbreak, and then through 2021.
That answers my question. Thank you. Do you agree that the provisions relating to the reportable incidents, or what are reportable incidents, is a very important mechanism for you to be able to determine if something is going wrong as far as NDIS participants are concerned?
It is a very critical part of our function.
The reportable incidents framework operates only in relation to registered NDIS providers. Is that correct?
That's right.
We know that 30% of the residents in SRSs are NDIS participants, correct?
That's right.
We also know that SRS providers do not, by reason of that, have to be registered as an NDIS provider, correct?
Sorry, can you just...
Someone operating an SRS does not have to be registered as an NDIS provider.
That's right.
However, they can also be an unregistered NDIS provider, can they not?
They could be.
If they are an unregistered NDIS provider and something goes wrong with the resident at the SRS, who is also being provided by the SRS provider with NDIS services, there's no requirement for to make a report of that incident.
Not a reportable incident, but there is a requirement for them to operate consistent with the code.
I'm sure that's right.
Yeah.
Yes, indeed.
Which includes coming
right.
to us when something goes wrong.
Has anybody given consideration to extending the reportable incident requirement to unregistered NDIS providers?
So we started work earlier this year when I started my tenure about how we might evolve the broader registration arrangements, and therefore including the responsibilities that go with being a registered provider, and thinking very carefully about how we might respond. There's a range of issues that sit in that registration space that need careful consideration.
Does that mean the answer to my question is yes?
Yes.
It would be a good idea, wouldn't it?
We need to, the challenge that we have is visibility of all providers and understanding what they need to do in terms of those reportable incidents. So we do need to look at it as a whole in terms of across the registration responsibilities and arrangements.
I understand that.
Yeah.
But it's rather difficult from the point of view of the people who receive services and who, by definition, if we're talking about reportable incidents, have suffered or experienced something that is unfortunate, that may range from death to a failure to administer medication on the appropriate day. It's rather unfortunate that there isn't an obligation upon people who are providing NDIS services to let you know that these things have happened.
I agree.
And therefore somebody needs to do something about it.
As I said, we've certainly raised this as part of the work we're doing on registration. Because
if someone looks at the Act, they may find that the Act authorises regulations that would allow you to do exactly that.
There are certainly, there is the authority that sits in the Act is broader than how we currently operate. So we're very conscious that there are arrangements that we could take that fit within the current Act. So that's why we're delving into a number of issues, including registration, to look at what we can do, and then, as a second step, what might need to change in the legislation.
Inventive legal minds might point out all sorts of possibilities under this legislation.
We've had a range of suggestions.
All right, thank you. Commissioner Galbally, do you have any questions?
One question would be that while it wouldn't deliver everything, would you be supporting the separation of accommodation from service provision as a requirement to reduce risk? And I understand the complexity of all the interconnected entities and, that they're set up with different names, but still as a beginning point, would it be a good idea that accommodation and service provision are not delivered by the same entity? I'd just like your comment on that, thanks.
I think what we've learned from a number of incidents that have occurred is that safeguards are work best when there are a range of safeguarding mechanisms in place. So therefore you have a range of providers providing those supports and services. But we've also learned from what we've collected over the last 4 years that simply separating the provider of accommodation and supports does not necessarily lead to a better quality or outcome or safeguarding for that individual. So it's not as clear cut as saying separation is the answer. There are circumstances in which the provision of both works quite well for a whole range of circumstances and characteristics, and equally there are circumstances where it doesn't work well. I think part of what we have to do, and we've done this, for example, in a range of SIL settings, is look at what are the practical mechanisms we can put in place and require of providers to try and clarify who's providing what, to try and provide certainty that it's at a level of quality that is required. They're the kind of things that I think are much more helpful in the space.
Oh, sorry.
If I could add to that, thinking about the system in the broad, people choose, and for some people with disability, choosing somebody who may be providing them with accommodation to also deliver their supports makes sense in terms of their particular circumstance. The issue for us is how we put protections around available to those people who do make those choices, where, and particularly focus where there might be risks. And I think that the evidence that the Commission's given previously, particularly in response to the Robertson review, is about the protective mechanisms we need to have in place so that NDIS participants can make choices freely and have us available or mechanisms available to assist them if they need. But the first principle of choice, and this is why I think if we take the example of Robertson, where Mr. Robertson, in response to, as part of his review into the death of Ms. Smith, and particularly the regulatory response of the Commission, he, for example, indicated that the Commission should take steps to remove the obligation or the choice of a person to choose to have a sole worker delivering their support. We consulted with people with disability and a number of parties about that, and there was a very strong view that that should not be a binary position, and that option should be available to people if they choose it, but that the mechanisms, that what the Commission should put in place are mechanisms to reduce significantly any risk that might present by putting additional obligations on providers where people make those choices.
I think that's an answer to the question. Yes. Commissioner Gelbley, do you have another question?
My only other question was regarding your comment, Ms. Mackey, about education and information, and just coming back to the workforce capability framework, where I notice homelessness is one of the areas in complex, challenging or changing circumstances. And I just wondered how much that's penetrated that capability framework, and whether SRSs would be aware of it, for instance, and how far it's reached, because it's a good resource. Well, it's a valuable resource, but how far has it gone?
So we agree the capability framework is a really valuable resource. It's relatively new, and we're just in the process of rolling out a number of tools for service providers and individual workers to make it easy for them to engage with the capability framework. So that there's if you like, a schedule of work that's happening around building people's awareness that the capability framework exists and how in which they can engage with it. We're also actively considering with our regulator, very much our regulator hat on, how we use the capability framework across the board. So for registered and unregistered providers, how do we start to point to, here's the expectation and this is the guide around the expectation.
Thank you.
Commissioner Rao.
Thanks. There'd be some people that would regard SRSs, because of their scale and size and staffing and the inability of residents to choose who they live with, and yet they've got to share very intimate spaces with them, they take the view that they are ultra vires of Articles 19, 22 and 28 of the Convention of the Rights of People with Disability. They clearly are notorious in terms of their risk.
Sorry, is there a question? I think
The question is, how is it possible for an SRS to get, or an entity associated with it, to get NDIS registration without very, very significant capability building prior to that happening? I think there'll be a lot of people asking how that happened.
So registration, gaining registration, providers will apply for a class of supports that might not actually be about delivering supports in an accommodation setting. SIL, for example, Winteringham talked about how they are registered to deliver support coordination, for example. So it depends on what someone's registering for. In the context of SRSs that are registered by the Commission, the majority of those entities transition to the Commission as registered entities prior to our commencement, and they've been going through a repeat a re-registration process where they've sought to continue to be registered. And they have to meet the same thresholds that any registered provider has to demonstrate, depending on the nature of the supports that they're applying to be registered for. We don't, as part of that registration, the standards do not look at the setting per se and make a judgment about the setting. They look at how the standards are applied in the context of delivering the supports that the provider's been registered for. I know that's not a particular answer to your question, but it's a description in the broad of the way in which the function operates.
So it's likely that many of the SRSs became registered entities by virtue of the fact that they were providing disability services prior to that, is it?
I couldn't say, Commissioner, how they became originally registered. There were arrangements in Victoria, as I understand, in every jurisdiction around registration into the NDIS, where prior to our establishment, and they may have been funded, for example, by the Victorian government for other things. In that example, they might have registered as new entities when the NDIS started earlier than our commencement.
Well, I think you'd agree that 43 years ago, every government in the country agreed that large residential centres should close. And there are many, many aspects of SRSs that look very similar to large residential centres. Do NDIS registration requirements or the code or practice standards need to be adjusted to prevent NDIS participants in exercising their choice and control from the unintended consequences of allowing the establishment of new forms of congregate accommodation which don't operate according to the convention, or assisting existing models being sustained by virtue of the fact that they're receiving funding under the NDIS? Do we need to look at something? Because it looks to me this is a broken model which needs to either be significantly reformed or abolished altogether.
Well, we understand that the Victorian government, and I'm sure it's a good question to put to those officials, is reviewing SRSs and their place in the Victorian accommodation market. It's probably an appropriate thing to do. Certainly, as you and I know from previous experience in our work in past lives in New South Wales, significant reforms around these kinds of settings was undertaken by the state government as part of a whole suite of looking at issues around tenancy and affordable accommodation for people on very low incomes, particularly people who are pension dependent.
Did you hear the evidence of a person called Colin earlier about in our inquiry into homelessness, where he talked about the services he received from his service coordinator. And they didn't appear to be very good. A lot of people have come to the Commission with complaints about service coordinators that they don't seem to know. They don't have enough information about the system to help them navigate it. They don't respond promptly to requirements. Do you think it's time to have some sort of strategy to educate and have service coordinators better understand their role?
So I didn't hear that the witness column that you refer to, but I have heard from many that we need to be much clearer around what we do in terms of support coordination, if that's what you're referring to.
That's what I mean, of course.
We have actually, it's part of the work that Ms. Taylor will undertake in her new role, where we're looking at doing a piece of work, quite a detailed piece of work, possibly in the form of a no motion inquiry, looking at those particular arrangements.
Thank you, Mr. Chair.
Thank you. I do have one more question for you, Ms. Mackey. You've been in the job for 7 months, pretty big challenge.
Mhm.
The Commission's been going for 3.5 years. I don't expect you to have read everything that your predecessor provided in the form of statements or the transcripts. But have you taken steps to determine what the Commission has learned or should learn from your Commission has learned from the work of this Royal Commission over its 3.5 years so far?
Yes, and certainly as part of my introduction to the organisation, I was also made aware of work that had happened prior to my commencement. And we continue to look at proceedings and learn and think about what actions that we might need to take and what work we might need to do. So we're certainly drawing in the information.
Is there some formal process in place to ensure that whatever is coming out of this Commission, for example, in the form of reports on particular hearings, that is taken into account and brought to the attention of relevant decision makers within your organisation?
Absolutely. And again, part of the establishment of the strategic advisor role was to look at the work of the Royal Commission and other inquiries and reviews to draw it into the organisation and think about, as I said, having that focus on continually improving and ensuring that we're doing our functions to the best of our ability.
Very good. Thank you. Now, I should ask Ms. Morgan if she wishes to ask any questions of the witnesses.
Thank you, Chair. No questions from me.
Thank you very much. Ms. Eastman, I realise we're a little behind time.
Yes.
What should we do now?
Well, it's 20 to 1 now, and I'm conscious that our interpreters will require a break. I had suggested that we have an early lunch, but I'm told lunch is not available till 1 p.m. So we could have a short break of 5 minutes or 10 minutes and then resume until 1, have a shorter lunch. Alternatively, if everybody can wait, maybe we should have lunch now and return, say at
I think it would be better to have.
What do you want to do?
To have a break now for lunch, only because of my back.
No, I'm conscious we've had a long run.
And then we can resume after lunch. And
Could
some
we
of us have had a chance to walk.
Right, could we come back at 1:30?
Yes, let us break for lunch now and resume at 1:30.
Thank you.
The Royal Commission is adjourned. The Royal Commission is resumed.
Ms. Bennett.
Commissioners, the next witness is Mr. Anthony Colmus, and he appears remotely.
Yes, we can see you, I think, in the distance. Thank you, Mr. Colmus, for coming to the Commission remotely, as it were, to give evidence, and thank you for the extremely detailed statement that you prepared, plus the annexure there too, which we have read. Thank you very much. If you would, well, just to explain where everybody is, Commissioner Galbally, I assume you can see her on a screen. She is joining the Royal Commission hearing from Melbourne. Commissioner Ryan is on my left. I'm the chair of the Royal Commission. We have Ms. Bennett in the same room, and Ms. Bennett, once she returns to the council's whatever it is, we'll ask you some questions. In the meantime, I'll ask you to follow the instructions of my associate, who will administer the affirmation to you. Thank you very much.
I will read you the affirmation. At the end, please say yes or I do. Do you solemnly and sincerely declare and affirm that the evidence which you shall give shall be the truth, the whole truth, and nothing but the truth?
Yes.
Thank you very much, Mr. Colmas. I'll now ask Ms. Bennett to ask you some questions.
Good afternoon, Mr. Colmas. Can you hear and see me properly?
Yes.
Thank you. You are the Director of the Human Services Regulator Unit, is that right?
That's right.
And what is the name of the department of which you are a part?
It's the Department of Families, Fairness and Housing.
And from a state perspective, you are effectively, along with your unit, the regulator of SRSs, is that right?
That's right.
And they are regulated primarily under the SRS Act and the SRS regulations. Do you know what I mean when I'm referring to those pieces of legislation?
I do, yep.
Now, most SRSs are pension level SRSs, are they not?
The majority are, yep.
And that means that residents of those SRSs pay 85 to 95% of their income and all of their Commonwealth rent assistance to the SRS proprietor, is that right?
That's right.
And in addition to that, many receive what we've called SAVI or PLP funding from the state government, is that right?
That's right, yep.
And most residents in pension level SRSs have a disability, is that right?
Yes.
You tell us in your statement that the figure is 79%. And I understand that figure to be higher in those pension level SRSs that receive SAVI or PLP funding. Is that right?
I think that's correct, yep.
Mr. Collins, do you know what the largest number of residents is in a single SRS in Victoria?
The largest capacity for an SRS in Victoria, I think, is just over 80.
And do you know if there are 80 people resident at that SRS?
As of a few weeks ago, we had cause to be in touch with the SRS. I think they had about 9 vacancies.
So there are 71 people presently resident in that SRS?
Approximately, yep.
And there could be 80?
There could be 80. Yep.
And there's no limit, is there, on the number of people who could be resident in an SRS?
Yes, the limit is set by the registration criteria. So each SRS is registered for a specific number of beds.
Yes, and is there a limit in the Act or the regulations as to how many the SRS could be registered to receive?
No, there's not. No.
And the SRS that has 80 residents, is that 80 rooms or 80 residents?
I would have to take that on notice and check. I don't know.
It could well be a number of the people in that SRS are sharing rooms, is that right?
That's right, it could be. Yeah.
Quite common for people in SRSs to share rooms, is that right?
It's not uncommon, that's right. Yeah.
Do you know precisely how many people are living in an SRS today in Victoria?
Not precisely. The most recent figure we've had, which we're not sure if it's 100% accurate, but it's a little over 3,100.
So how do you know how many people are in SRSs at any given time?
We don't necessarily.
So you know the maximum number that could be in SRSs, is that right?
That's right, yeah.
And the maximum numbers as at today could be 4,000 in Victoria, is that right?
That's right, yep.
Right. Now, my learned colleague, Ms. Eastman, recently took some witnesses to a document called the NDIS Commission Compliance Strategy, supported residential services in Victoria. The commissioners will find this in folder B2 at tab 7. Have you seen this document before this hearing?
No, I haven't.
Were you involved in consultations with the NDIS Commission about the formulation of this strategy?
I was aware of the strategy, and I was aware that there was a paper being developed and a piece of work being developed by the NDIS Commission with regards to SRSs, but I wasn't, other than conversations we have on a regular basis regarding specific matters, we weren't involved specifically in the development of the strategy.
You'll notice that there are numbers at the top right-hand corner of that document, and they have 4 digits at the end, 0001 and so on. Could you go to 0006? And you'll find there the paragraph above the dot points commences with the words, the NDIS Commission is aware of and responding to the following types of issues impacting NDIS participants living in SRS through the management of complaints it has received or compliance and investigation activities. The first is the financial exploitation, where the SRS operator uses NDIS funds, as well as payment already made by the resident from their pension, to pay for the same supports or provides no services at all after depleting the person's NDIS plan. Mr. Colmas, are you aware of that issue impacting on SRSs in Victoria?
We've had allegations made or concerns raised that people who are in receipt of an NDIS package and who live in an SRS, yes, are paying both SRS fees for supports and may also be being charged for NDIS supports for the same supports.
There is the potential for substantial overlap, would you agree, between the supports provided that an SRS proprietor is required to provide and the supports which might be provided under NDIS funding? Do you agree with that?
Yes.
Could I ask you to say yes for the transcript?
Yes.
Thank you. Would you agree that that is financial exploitation of people with a disability?
If it's occurring, yes, it would be.
Yes. And that would be a matter of substantial concern to you if it were occurring?
Yes, it would be.
And what steps have you taken to investigate whether it is occurring?
So whenever we receive concerns regarding matters of that description, we usually contact either both the NDIS Commission and potentially the NDIA as well. We don't have access to the NDIS documents, but we do have access to the ongoing support plan that's developed for SRS residents. And we would normally share that with, we would work out with the Commission in particular who's best placed to investigate the issue depending on the particular circumstances of that issue.
Mr. Colmas, I'm talking to you though about a systemic problem across the SRS sector. Are you aware of the extent of this potential exploitation across the SRS sector in Victoria?
In terms of numbers of complaints about this specific issue, we actually haven't had that many. We've had a few, but it certainly hasn't been what I would consider a systemic issue per se. So it's been, off the top of my head, maybe 10 to 20 complaints regarding that, but that's...
From different SRSs?
Not that many SRSs, no.
So the public advocate has raised this concern with you, has she not?
Yes, we've talked about it with the public advocate, yeah.
And she has, she's raising a broad and systemic concern there, isn't she?
Yes.
And I'm sorry?
I was just going to say, I mean, she's certainly concerned that it could be.
Yes.
We don't have evidence at this stage of how broader it is, how broad a concern it is.
It is your responsibility, isn't it, to identify how widespread this conduct is, isn't it?
Yes, and to that end, we've sought information and received information from the NDIA in terms of all of the SRSs that receive where payments for NDIA supports are being provided to someone living within that SRS. But in terms of the number of actual complaints about that activity, like I said, it's actually not that many to date.
I'm asking Mr. Commerce about the proactive steps that you as a regulator are taking to identify and then prevent exploitation. So as I understand your evidence, you've sought information from the NDIA about NDIS participants living in SRSs, is that right?
That's right, yep.
And do you also cross-reference the place of business or the identification of NDIS providers with SRS providers?
We've provided information to the NDIS Quality and Safeguards Commission regarding, so we've had discussions with the Commission on a number of occasions about exactly that issue, about trying to identify and match up SRS proprietors with the NDIS registered providers. And we've provided information to the Commission with details of the SRS, their address, the registered proprietor, the company that's in charge of the SRS, and company numbers, so that they can try and align that. It's proven to be much more difficult than anticipated because the NDIS registered providers are often completely separate companies that aren't necessarily overtly have any obvious connection to the SRS companies.
So returning to my original proposition to you, which was that this was a matter that fell within your scope as a regulator, why is it something that you're sending off to the NDIS rather than investigating yourself?
Well, it actually affects both of us. So
yes.
It's from an SRS perspective, if it is the SRS proprietor that is charging for both, then yes, it falls into our remit. And the idea of asking the NDIA for where NDIS funds were going to was so that we could have a sense of which SRSs could this potentially be happening with. But it's also an issue for the Quality and Safeguards Commission in terms of the provision of NDIS supports and how they line up.
So my question is directed to you as the regulator in Victoria. Are you taking any proactive steps to identify where there is this potential for the exploitation of people with disability through this double dipping?
It could. Like I said, by knowing which SRSs have NDIS packages being paid into them, that gives us a potential line of sight of where it could be occurring. We also, through complaints that are referred to us from the Commission, that also gives us an idea of where that issue might be occurring. But like I said, we don't have access to NDIS plans. So we can view SRS ongoing support plans that are developed for people, but we don't automatically have access to NDIS support plans to be able to line the two documents up and compare them. So it's very much, at this stage, it's very much a case of identifying issues as they occur. So whether it's through support coordinators raising concerns with us, whether through complaints to the Quality and Safeguarding line, whether it's families bringing concerns to us about a potential double up, that would typically then enable us or give us a line of sight into issues.
Is it fair to, as a matter of fairness to you, Mr. Commerce, is it right to say that the orientation of your office, your unit, is that it is at present reactive to complaints and issues as they arise, rather than proactively trying to track this down?
In relation to this specific issue?
Yes.
Yeah, to a degree, yes.
Yes. The second dot point is that a concern regarding the trading of residents between SRSs or entities associated with SRSs where the value of the NDIS plan makes these residents lucrative for unscrupulous operators. This includes relocating residents to private accommodation which does not have the oversight of the HSR, that being your unit. Are you aware of this issue?
Yes. Yep.
And do you consider that a risk to people with a disability who presently reside in SRSs?
if they're in receipt of an NDIS package, it can be a risk. Yep.
Well, is it a risk to them that they are moving out of a system that has the oversight of your unit?
It depends where they go. So it depends whether the accommodation they're going into has some form of regulatory oversight or not.
So are you aware of the issue of what the public advocate yesterday referred to as pop-up SRSs?
Yes, I am.
This is really related to that issue, isn't it?
It can be, yes.
And
that's one type of accommodation that people might relocate to, either by their choice or, that will be relocated to.
well, pop-up SRSs would be an unregistered SRS, would it not?
If it hasn't applied for registration with us, then yes, it will be an unregistered. Well, not quite as simple as that. It will be a disability service. If someone with a disability is relocated to another form of accommodation, so a shared rental house, for example, that may or may not be an unregistered SRS, depending on the nature of the supports being provided. And if they're not receiving disability supports per se and not paying a board and rent component on top of NDIS package, then it's not necessarily an unregistered SRS.
So a premises where accommodation and personal support of some kind are provided for a fee, that is a supported residential service, isn't it?
If there's a fee from their personal income as opposed to from their NDIS supports, then yes, typically that will be a very strong indicator that it's an unregistered SRS. Yeah.
So there's a distinction, is there, between where the funds for the personal support come from? So where they come from individual income stream, it might be an SRS. Where they come from the NDIS to the participant to then be dispersed, that is different. Is that your evidence?
That's right. Yeah.
And is that, do we find that in the Act? That distinction?
Well, the SRS Act was promulgated well in advance of the NDIS, so it's not in the the SRS Act. I don't know if it's in the NDIS Act, but in order for it to be considered an SRS, and the SRS Act is a bit unusual in that it defines an SRS by what it's not rather than what it is. But typically, like I said, if someone is paying out of their own pocket a board and lodging fee of some description to receive supports in an accommodation setting, then typically that would be a very strong indicator that it is an SRS. Yeah.
Is that position in relation to the relevance of NDIS funding as to whether or not it's an SRS? Is that a position that's been developed by your office?
Not by my office per se. If the person is only receiving supports that are funded through the NDIS, then from our perspective, it wouldn't qualify as an SRS.
All right.
It would be a disability service where the supports are being funded through the NDIS supports, like what would typically be considered a disability service.
All right. I'm going to just read out the balance of the dot points in that document I was just asking you about to get your views as to whether these are prevalent concerns that your office responds to. Complex business networks established by SRS operators to which operate collectively, providing a range of supports and services and duplicating costs already met by a participant, where the relationship between these businesses is not transparent to a resident. Poor or non-existent record keeping by SRS operators, resulting in a lack of transparency for residents about what they are paying for and limiting the information available to the regulators to pursue lines of inquiry, residents being limited in their choice of other providers and the ability of other providers to deliver supports in SRSs, or significant conflicts of interest between SRS operators and other providers involved in a person's support, coercion of residents, particularly those at greater risks of such practices due to cognitive impairment, and finally, the lack of skills and competency of the SRS workforce to deliver NDIS supports and services to the level required by residents. Now, these are all matters that have been drawn to your attention in the past, are they, Mr. Colmas?
If we can tackle, or if we can go through each one, perhaps,
Yes.
rather than an overall summary. So the complex business networks, that is an issue, which we've heard about both in relation to SRS providers who have multiple companies and or NDIS registered providers who have multiple companies. So yes, that is an issue. As to whether the residents would typically understand the connection between those companies, I imagine there are times when they don't, but I can't speak obviously for every situation. Poor or non-existent record keeping by SRS providers. Typically the supports that are to be provided to any person living in an SRS are normally documented in the ongoing support plan. That is a legislative requirement that's to be developed by the SRS. Certainly the quality of those support plans, like the rest of the sector, varies. Some are very good and provide a really good level of detail about the supports being provided. Others are not as good. So that can be an issue. Residents being limited in their choice of other providers. That can be an issue. Different SRSs have approached that differently. Some SRSs absolutely have a number of different NDIS providers coming into their SRS to deliver NDIS supports, and it's completely up to the client. Others have taken a view where they do have an NDIS associated company and have made it clear that their strong preference is that people use that company. And we have had to step in a couple of times to make it clear that people do in fact have a choice about where they get their NDIS supports from. That can vary in terms of clients who move into an SRS and whether they're informed of that upfront, as opposed to clients who already live in an SRS who might then receive NDIS supports and what level of choice they have about those supports. Coercion of residents between that. Yes, unfortunately, coercion of residents does seem to take place in some situations. And certainly we took regulatory action against a provider just recently. And that was one of the reasons we took that action, because we believed that was happening. The lack of skills and competency of the SRS workforce delivering NDIS supports. The SRS workforce doesn't by definition necessarily provide NDIS supports. So there may be some situations where SRS staff, when they're not rostered for the SRS, would be rostered to deliver NDIS supports. That's possible. But SRS staff typically are delivering SRS related supports, and NDIS funded supports should theoretically be delivered by a separate group of staff.
Yes, okay.
But sometimes the two, you might use the same staff member, so long as they're not on roster at the same time for both the NDIS and the SRS. Yeah.
I say, and would you accept that there have been concerns or complaints about the lack of skills or competency of the SRS workforce to deliver SRS supports?
Yes, there have been concerns about that. Yep.
So there have been, is it fair to say, Mr. Colmas, there have been a number of concerns raised, a large number of concerns raised from a number of quarters about substantial issues about the quality and efficacy of SRS properties in Victoria?
As a sector?
Yes, as a sector.
Yeah, as a sector, there has certainly been fairly broad criticism of the sector. I think like any sector, there are some SRSs are better than others. So I don't think you can necessarily, or we can necessarily take the point that all SRSs are a concern, but as a sector, absolutely, it has had numerous criticisms of how it operates.
And there are substantial concerns across the sector into matters that go directly to the safety of people with a disability living in an SRS. Is that fair?
There are definitely safety concerns in relation to some SRSs within the sector, and that's been borne out in some of the cases that we've had to deal with.
I should say the safety and support of people with disability. Is that understood to be encompassed within that question? Yes. Let me ask again. Is it fair to say that there is a substantial concern across this sector for matters which are relevant to the safety and support being given to people with disability in SRSs? That's fair?
As a broad general view of the efficacy of the sector, yes, that would be fair.
Yeah, and is it all likewise fair, Mr. Colmus, that the complexity of the resident profile, of the presenting resident profile, has increased over time in the SRS sector?
I've only been in this position for just coming up to 3 years. My sense from talking to colleagues, from different reports and information I've read would be yes, that would be my sense, is the complexity of clients is increasing.
So of all of these issues and concerns that you are aware of, can you tell us and tell the commissioners what are the regulatory response? Well, I'm going to go through the regulatory responses at your disposal. So you have the power to issue an infringement notice, is that right?
That's right, yep.
And how often is that used?
We haven't yet used an infringement notice.
So you've had that in your toolbox since 2010, is that right? I mean, you as in the unit has had that in its toolbox since 2010?
The department has had that as a tool in its regulatory toolbox since 2010, yes.
And it's never once had an incident where an infringement notice might have been appropriate?
I can't comment for the period prior to 2019. I'm not aware that they have, but I can't comment specifically for the period prior to September 2019.
Well, see, right, well, has it been, would you consider that to be a fairly important tool, the infringement notice tool?
It's one of a number of tools that the Act provides for. I think the aim of any regulator is to bring or to keep regulated entities in compliance. An infringement notice is one of those tools, absolutely. But there's also a range of other tools that can be just as effective in terms of bringing providers into compliance or ensuring compliance. Yeah.
Right. You can issue a compliance notice, is that right?
That's right, yep.
You tell us in your statement that they were not in much use prior to 2018, is that right?
Yes, prior to 2018, and again, I'm relying on information from colleagues and reports. Prior to 2018, whilst I understand that there were some regulatory sanctions used in the years between 2010 and 2019, for the most part, the regulatory approach was to provide support and guidance to SRS proprietors to assist them to reach compliance. And that was usually in the form of either advice or guidance letters, etc. And I think in 2018, the unit, which had just been formed at that point, the unit I'm now in charge of, began using compliance instructions, which are still an administrative tool, so it's not a statute in the Act. We first began using compliance notices in early 2020.
All right. Do you consider, is that a regulatory action, a compliance notice?
Yes.
So that triggers when you issue a compliance notice, you'll inform the NDIS that you've done that?
No.
No?
No, not necessarily. If it specifically relates to an issue that we think is of relevance to the NDIS, then yes, we would let them know, the Commission know. But the vast majority of them don't necessarily relate directly to NDIS provided supports.
Your evidence earlier was that it's difficult for you to have insight into when an NDIS provider is involved. Is that not the case?
If the support is actually being delivered by an NDIS provider, then typically we can work that out. But a compliance notice is issued to an SRS proprietor where we believe that they haven't met their legislative obligations in relation to the SRS Act per se. So what they should be doing in terms of delivering the SRS and supports within that, as opposed to any other type of support.
So when do you inform the NDIS of concerns that you might have as a regulator?
If in the course of investigating an issue that we think might warrant a compliance notice or something more, if we believe that there's an NDIS support element to it, that's when we would let the Commission know. Because sometimes it's quite clearly an issue that's confined to the SRS and the types of or the obligations the proprietor has under the SRS and has nothing to do with an NDIS element at all.
So who's making that judgment? Is that you or an authorised officer?
It would typically be a combination of an authorised officer along with we have a management structure above them between myself and the authorised officers. And then if it was a particularly serious issue or widespread issue, then it would be brought to my attention. Yeah.
And that's in the evaluative judgment of the authorised officer to bring it to your attention.
So we have a director of compliance.
Yes.
We have a statewide manager of regulatory compliance and enforcement who also has a significant role in overseeing SRSs. And we have two managers, one for the south and east and one for the north and west. So that's the line management structure that sits above the authorised officer. No compliance notices have to be signed off by the director of compliance or myself. So any authorised officer that was recommending a compliance notice be issued, they have to document the reasons why they believe it needs to be issued, the evidence that they've gathered, any relevant information that's put in a brief up to.
I'll just pause. I'm sorry to interrupt you, Mr. Collins. I'm conscious of the time and I understand the point, so thank you. How many authorised officers do you have in the unit?
Currently, we have 21.
21, and they're responsible for regulating all 114 SRSs. Is there anyone else involved in going out to see SRSs?
They're the main people that would go out to see SRSs. We have a different team that's involved in the registration of SRSs.
Yes.
So they hold that function. And the authorised officers primarily spend most of their time regulating SRSs. But as a regulator, I'm also responsible for two other acts of parliament. So they also do spend some time in relation to, for example, the Disability Act and occasionally issues arising in relation to the Children, Youth and Families Act.
Does an authorised officer visit every SRS every year?
That would be the aim. It doesn't always happen.
Does an authorised officer set foot in an SRS every 6 months? I'm sorry, every 18 months. Every 18 months.
Again, that would typically be the plan, but that can depend on if we have priority issues come up or priority investigations that require a much more intensive input or much more resource intensive input, then that would take priority over a visit to what we consider a low risk SRS, for example.
So you've got, do you have 21 full-time equivalent staff or 21 staff?
No, I have approximately 45 FTE.
So 45 FTE. across. And then for authorised officers carrying out the regulation of SRSs in Victoria, you have 21. Are they 21 full-time equivalent?
A few part-timers, but it'd probably be about 19 FTE.
Okay, well, let's call it 20 people are regulating 114 SRSs. And when a substantial regulatory response is called for, that will divert resources from the other SRSs. Is that right?
That's right, yeah.
Mr. Colmas, is 20 people enough to regulate these environments?
I think like any regulator out there, if someone offered me more resources, I wouldn't say no. I think that the challenge for government is to decide how much they invest in regulating services as opposed to actually delivering services that are required on the ground. So it's the proverbial how long is a piece of string.
Well, no, we've got a very specific sector here with very specific problems that we've gone through and identified. In light of those problems, Mr. Colmas, are the 20 people you have on the ground sufficient to respond in a way that is proactive and responsive to the needs of people with disability?
At the moment, I would have to say that we're probably being less proactive than I would ideally like. I think, having said that, I think for the most part, we're across the key issues that are arising and we're able to deal with those. But yeah, in an ideal world, I would want to be a little bit more proactive than we currently are.
Well, not the ideal world, Mr. Colmas. The world that we're in, you're able to, is it the case that you're able to respond to issues as they arise, but not to proactively go out and find the problems?
We can do some of the latter.
Yes.
But not as much as we would like to.
Yes. So fair to say, well, we've had some evidence, Mr. Colmas, that there is a risk that SRSs can't operate in a way that is both ethical and viable. Have you heard that evidence?
I've heard evidence that where people have expressed the view that their SRSs are not viable.
Yes.
Ethical, I think I've heard in relation to specific SRSs. I can't say I've heard that in relation to SRSs across the board.
Right. So you've heard it said that it is not possible to operate, I should say, as a matter of fairness, a pension level SRS in a way that's viable. Is that, you've heard that evidence?
I've heard that in evidence, yeah.
And have you heard that concern expressed elsewhere? Is the first time you're hearing that concern this week, Mr. Colmas?
No, it's not. No.
You've heard it before from others, is that right?
Yep, and certainly it's a view that it's an issue that we ourselves are contemplating on a regular basis.
Well, how does it arise in the context of regulation?
Because one of the, so for example, one of the registration criteria for an SRS is that they have the financial capacity to operate an SRS, that they actually have the means to run the SRS. So on occasion, we have reason to be concerned about whether in fact that's the case, and that might come through if an occupancy level is particularly low, or maintenance of the site is not being kept as much as we would expect. Then we might have reason to be concerned that in fact the SRS is struggling financially. And if that's the case, we can ask for what's called a registration statement, whereby we seek a range of information about the operation of the SRS, including financials, to assess whether in fact it continues to be going or continues to be viable. Yeah.
Does an SRS that is struggling with viability, does that give rise to a risk that it will cut corners?
Yes, it could do.
And does it give rise to a risk that it will seek out new and inappropriate revenue streams?
It would put more pressure on them to think about a wide range of of revenue streams. Whether they're all inappropriate or not is another issue, but certainly it will put increased pressure on them to find other and try and engage with other revenue streams, yes.
Is it something that informs your approach to the regulation of this space? So do you avoid taking regulatory steps that might impact on an SRS's viability?
No. So if an SRS is struggling financially, we may well be aware of it, but we wouldn't take that into account in terms of if we felt we needed to take regulatory action in relation to that SRS, then that action would be taken. If the action we took, so for example, if we've in a couple of instances we've suspended admissions to an SRS, which has a potential financial impact on that SRS. If we already had concerns about the financial viability of the SRS, then that would be something we would monitor perhaps even more closely, depending on how long the suspension remained in place, etc.
Well, you say at paragraph 63 of your statement that the power to suspend admissions has been used sparingly. The power has the benefit of preventing a non-compliant SRS from taking on and providing substandard care to any additional residents. However, it also gives rise to a potential increase in risk to residents of an escalation of substandard care through impacting on the financial viability of the SRS, which can in turn cause a risk to resident health and safety if a proprietor chooses or needs to reduce costs. For that reason, I would typically only consider using a suspension of admissions in the narrow circumstance of a compliance issue being serious enough to outweigh the latter risk. Mr. Thomas, aren't there other options to ensure the safety and services to the people living in the SRS in a non-compliant SRS?
So typically, when we identify non-compliances within an SRS, the first option, unless it's particularly serious and we think there's evidence that warrants jumping to the more significant forms of regulatory intervention, typically the first forms of regulatory action we would take would either be a compliance instruction or more commonly nowadays, a compliance notice, which basically instructs the proprietor as to where we believe them to be non-compliant and gives them a time frame to bring themselves back into compliance. In almost all cases, with the exception of two that I think I mentioned in my statement, in almost all cases, those compliance notices have in fact resulted in SRS proprietors addressing the non-compliance involved and becoming compliant again. So that's typically the most common form of regulatory action we would take. Where in the two instances where I engaged suspension of admissions, it was where either the compliance notices were partially met or there were significant delays in meeting them, or we felt that the proprietor wasn't making in good faith efforts to address the compliance notices. So the suspension of admissions was used to escalate the action and becomes more of a sanction rather than just a remedial notice. Yeah.
Now, you gave some evidence. Well, you gave some evidence earlier that there are some concerns around the quality of ongoing care plans. Is that right?
That's right. Yep.
So every resident must have an interim plan within 48 hours of arriving at SRS and an ongoing plan within 28 days. Is that right?
That's right.
And they are intended to set out the care needs of that person who is to be a resident of the SRS.
That's right.
And then the SRS must provide that care. Is that right?
That's right.
And indeed, it's an offence not to provide that care.
Yes.
Now, who writes the plans?
It would usually be the staff within the SRS.
And do they have any? Do they necessarily have any clinical training?
The majority of SRS staff would not have clinical training per se. When you say clinical, do you mean like as in medical, etc., or?
Yes.
Yeah, no, the majority of SRS staff would not have clinical experience or training.
And the SRS staff who prepare those plans. They're then kept at the SRS, and are they reviewed by your staff?
Yes.
And so
Well,
what process do your staff go through? Your authorised officers attend the SRS, they ask to see the plans. Do they then consider the content of the plans against the needs of the individual?
we don't know every individual within all the SRSs, so we don't know on a person by person level the details of each person's support needs. What we look for in the plan is, does it cover off the key areas that someone's likely to need support in? Does it detail, medical referrals? Does it detail the types of support that might be required, including other contacts that the person might have, whether it's GPs, whether it's community health services or mental health services. So what we would look for is the plan representative of the type of information you would expect to see for people living in an SRS.
You provide a template plan, don't you? On your website, you provide a template care plan, don't you?
We do, yeah.
And that has boxes with each of the content requirements that the SRS is required to fill. Is that right?
That's a guide based on our interpretation of legislation. So it's not compulsory that they use that template, but that is a good, we consider it a good guide, that if they're using something similar to that, then typically that plan would be acceptable. Yeah.
So as long as each box is filled, it would probably pass the test. Is that fair?
It would depend on the quality of information in each area of the plan. Yeah.
But no one's checking to see if that information bears any resemblance to the needs of the resident at the SRS. The actual needs of the person with a disability.
Like I said, we don't have a line of sight of the needs of the 3,000 people currently living in SRSs. So no, we can't compare it to the actual needs of the people living in that SRS. Like I said, what we look for is a plan that seems to cover off the range of support needs that you would typically expect a plan to include.
So there's no mechanism in anywhere in the system for to ensure that the plans are adequate or comprehensive or even appropriate. Is that fair?
We can check in terms of the comprehensiveness of them, in terms of the range of supports that might be covered off in the plan. But I think if what you're asking is, can we be 100% confident that the plan relates directly to the support needs of each and every person? No, we can't.
Not 100%, Mr. Colmas, to any extent. You know nothing about the needs of the individual resident at the time that your staff are reviewing the plans. Is that right? You've never seen them. You've never seen their medical certificates. You're just looking at the support plan created by the SRS provider. Isn't that right?
Yes, taking into account authorised officers, because the authorised officers will often, they become quite familiar with SRSs and the people living at them. So they would they wouldn't know individual needs, absolutely. But with years of experience, you tend to know the types of things that you might look for in a plan. But no, in terms of individual needs, no.
And wouldn't SRS providers come to know what sorts of things pass muster in these audits?
They may, yeah.
That's a risk, isn't it?
Potentially, yes. I guess.
Sorry.
Yeah. I mean, yes. If you work on the basis that the SRS proprietors are fundamentally only ticking the boxes, so to speak. But again, we get a sense, through our engagement with proprietors, through our contact, through different reports that come in, through incident reports that come in, and how proprietors have dealt with them. We develop a sense, and we have a risk rating system for proprietors, which gives us an idea of which are the ones that in our view, seem to be absolutely trying to do the right thing and in the most part are doing the right thing, which are the ones that we're not as confident about based on a whole range of information that comes into our office about the performance of a proprietor. So, and that would inform how closely we need to look at plans or other documentation within an SRS. Yeah.
I'd like to suggest to you, Mr. Colmas, that the person with a disability is not at the centre of that process, the document is. Is that fair?
By virtue of the fact that we don't know the individual clients across the board, that's a reasonable assertion to a degree. But like I said, the idea of the plan is to bring that focus onto the person. Yeah.
What are the qualifications of your authorised officers to be making the assessments?
Many of them have worked in, well, some of them have worked in clinical settings previously. Some of them worked in regulation in other areas. Some of them have worked in disability services in the past, and so have brought those skills across to the current role. We have a pretty broad range of authorised officers. Is
there any minimum requirement?
There's no minimum qualification per se. It's a lot of it is based on experience and, depending on the roles they previously held, an ability to inquire, to know, to be able to develop how to use information to bring a picture together that gives them an idea of whether an SRS is operating as it should or not. Yeah.
In the context of the pop-up housing that we were discussing earlier, you have the power to seek a warrant to search a premises to determine if it is an unregistered SRS, is that right?
That's right, yeah.
And is that a power that you have ever used?
Yes, we used it in relation to a currently ongoing matter where through concerns raised by a local community, we were made aware of a house operating in Melbourne where people were being supported. It seemed like they were people with disability. We were able to establish and gather enough information to warrant or to establish the grounds for a search warrant, which we then issued on the proprietor to gain entry to the premises.
Mr. Colmas, have you watched the evidence this week?
I've seen a number of witnesses. Yeah.
Yes. Did you see the state of Belle's bedroom? Could I ask the operator to show it? This is taken from an SRS last month. Is this consistent with your expectations for the sector?
The bed is a concern, I would have to say, in terms of the standard of cleanliness of the bed. The rest of the room and the size of the room is I don't know if that picture encapsulates the whole room or not. In terms of the general tidiness of the room, I know that people who live in SRSs are typically reasonably independent. They will often require some levels of support, but they also have the right and the skills to operate or live their lives reasonably independently. So often they make choices about how they want their rooms to be, which wouldn't necessarily be what I would look for. But there's a fine line there between at what point does the proprietor have an obligation to step in and ensure that the room is safe and clean, as opposed to the client's right to well, this is how I want my room. I'm paying for this room, and this is how I'm comfortable in terms of what I want the room to be.
Does this room raise concern for you as the regulator of this space?
Yes, it does in relation to the standard of the mattress, absolutely. And
that's
like
the only matter in those two photographs that causes you concern.
Like I said, I would want to see how big the actual room is, but the standard of the mattress would be my main concern. Yeah.
And can I add, can I bring the photos down? Can I add that this is a person who has cleaning and assistance with room cleaning written into her SRS care plan and has substantial NDIS supports for the same thing. Do these photographs raise concerns for you around those issues?
Again, it would depend on what choice the resident has had in whether that's how she wants her room to be or whether she's comfortable with that or not. If she's wanting a much cleaner room and that's not being delivered to her, then absolutely that's a concern. But there are a number of people who live in SRSs who, like I said, who make choices about how they keep their rooms, which I wouldn't make those choices, but they have.
So an NDIS participant and an SRS resident would be paying for assistance to clean their room and would be paying for assistance from the NDIS, and that would still, is there evidence that if they've denied entry to the room, then that would be a concern, but if they haven't, then it would be a concern? Is that fair?
Denied entry or denied access, denied people being able to clean the room.
Yes.
In either situation, if the room was of a real concern, so it was potentially dirty or unhygienic, if the client was still refusing to allow people to clean the room, what I would expect would be that there'll be in their support plan or in the support strategies somewhere, I would expect that the proprietor, I don't have any control over the NDIS supports, but I would expect the proprietor to have some sort of plan in place as to how do you encourage the person to take better care of their room, better care of their health, etc. So, and make them aware of the potential concerns. So that's what I would expect. The difficulty, and I'm aware of a number of situations where clients have made it very clear they do not want SRS proprietors cleaning their room, and that has absolutely presented issues. But the proprietor likewise is in a position where they can't force their way into the room, that would present other issues as well. If they forced a paying client to allow them to take over the room, to clean the room, etc. So there's a fine balance to be struck there.
All right. You heard the evidence. Did you hear the evidence of Georgia this morning?
Yes, I did. Yeah.
Have you ever recently written to Georgia? Have you ever written to Georgia to express any concerns about the way in which her complaints were managed?
No, I haven't.
Do you have any concerns about the way that her complaints were managed?
Yes, I guess I'd begin by saying first that, yeah, that whole set of circumstances was incredibly unfortunate, and I completely understand George's level of distress about both obviously her mum's death, but also the circumstances that arose in relation to it. It was a particularly messy matter in terms of the information we were getting, in terms of and contradictory information we were getting. And even at the end, I think Georgia mentioned that she'd had a phone call from a regulatory officer saying, well, in fact, an email, I think, explained to her the outcome of the investigation. Yes, there's a point at which an investigation closes, but in that particular matter, I think we could have done better.
All right. Have you ever told her that?
No, I haven't. No.
You think you ought to tell her that?
Yes, that would be a fair point. Yep. Now that yep.
In paragraph 165 of your statement, you refer, I think, to this matter. I'm not going to refer to the name of the institution or the SRS, but you say that After referring to the circumstances, which one can readily understand were extraordinarily distressing to the family members, the proprietor was issued with a compliance instruction regarding the action or lack of action taken to preserve the dignity of the deceased. What could a compliance instruction do in that situation?
So just to be clear, one of the corrections in my statement was that in fact, in the end, the proprietor wasn't issued a compliance instruction. What happened in that situation was the authorised officers conducting that investigation made recommendations regarding what they thought should happen. And one of the things they thought should happen was a compliance instruction be issued to the proprietor based on the management of the person's, of the deceased body. When and I referred earlier to the line management structure, when we looked at the actual act and the obligations of the proprietor, it actually wasn't a breach of the act per se. So there was no legislative breach that we can evidence in that situation. Incredibly unfortunate, and I like I said, I completely understand that if it was my parent, or I'm sure in George's case, she made it really clear this morning in her statement that she found it really distressing that her mum was, her mum's body was left on the ground. But in and of itself, that did not warrant, or that did not constitute a breach of the Act. So, as a
Section 7 sets out the principles. Residents of supported residential services have the same rights and responsibilities as other members of the community, and so on.
Yep.
The following principles apply. Individual rights of residents should be respected by recognising a resident's right to, among other things, dignity and respect. Now, I appreciate that the resident had died, but why does that preclude a breach of the Act if the service provider, the SRS, manifestly breaches the dignity and respect that ought to be accorded to every human being in the way they treated this person who had died?
To some degree, and again, this is just an unpleasant situation all around.
Yes, no, we understand that, but I'm just trying to understand why there's no breach of someone's obligations. That's what
the view we formed was that the fact that the person was deceased technically meant they were no longer a resident, but also they were on the ground. My understanding is, and this is where some of the contradictory information came to the fore. My understanding is they were on the ground for the ambulance and paramedics to assist them, to work with them. The police, I think it was either the police or the proprietor, then covered the body, and that was where Ms. Wilson identified her mum. We've certainly, at the time and since, we've talked about whether there should have been an expectation that someone would move the body, for example, to a bedroom. I think in situations like that, sometimes people can be unsure of, are they allowed to move a body in a situation like that or not?
That's a rather different matter. What you're saying is that since the resident had died, she was no longer a resident, therefore there was no obligation to preserve her dignity or autonomy in the way in which her body was to be treated, notwithstanding that she had died while in the accommodation and under the care of the SRS. That's the point you make.
As awful as that sounds, yes.
Well, I wonder whether that's a possibly disputable interpretation of the legislation, but we won't pursue that any further.
Mr. Chair, it might be a convenient moment for me to do what I ought to have done at the start of this session, which is to read in the corrections to Mr. Colmos's statement. Mr. Colmos, you made a statement to the Commission in response in response to a notice, you'd like to change the following parts. At paragraph 165, we've just been looking at, where the words, however, the resident was placed there by Ambulance Victoria, not the SRS, you would like to delete those words. And in the penultimate line of that paragraph, I'll withdraw that. And then where the paragraph goes on to say, the proprietor was issued with a compliance instruction, you would like to change that to be the proprietor was not issued with a compliance instruction.
That's right.
Then at paragraph 177, where it says in May 2019, the Human Services Regulator Unit learned whilst undertaking an inspection at a particular SRS of an alleged sexual assault, you'd like to delete the words whilst undertaking an inspection at and the following 3 words.
That's right. Yep.
And then finally at paragraph 178, where it says, it was noted that the proprietor had conducted his own investigation of the matter and when asked to do so, you would like to add the words after the word asked by Human Services Regulator Unit staff. Is that right?
That's right. Yep.
With those changes, Mr. Colmas, is your statement true and correct?
It is. I am able to provide an update if relevant to Annexure 4, so in relation to which originally formed a different part of my statement.
I think we'll seek that if it becomes necessary, Mr. Colmas.
Yep.
Commissioners, those are the matters I seek to raise with Mr. Colmas this afternoon.
All right, thank you very much, Ms. Bennett. I'll start by asking Commissioner Ryan whether he has any questions to put to you.
Just take you to the evidence that we received about pop-up and unregistered SRSs. Have you done have your officers done anything in regard to exercising your powers to determine whether or not you have any unregistered SRSs that haven't been registered, and have you taken action to see that they become registered?
Yep. So we have 2 matters currently active. One that we've been dealing with now for a number of months, where we have absolutely formed the view that the accommodation setting in question is an unregistered SRS. We have suspended. That's the one where we conducted a search warrant to establish that in fact it was an unregistered SRS. We have since suspended admissions at that site, so the person is by law not able to take any further clients into the site. We've also worked with the Office of the Public Advocate. There's 1 client currently remaining at that site, and we have worked with the Office of the Public Advocate in relation to guardianship arrangements for that person, so that hopefully that person can be supported to decide whether he wants to continue to live at that site or move out. If he was to move out, then there will be no further clients living there. That it will remain an ongoing investigation even if that happens. So we are currently considering what further action we're in a position to take in relation to that matter. The second issue that we currently have, I think Dr. Pearce mentioned it yesterday, 2 houses that we were recently informed about, I think in Preston and Reservoir, I think if I'm correct, where it appears that they may be an SRS. We literally found out about this, I think it was last week. We have reached out to the local council, to see whether those properties are on their radar, which they are. So the local council is aware of the properties and is currently dealing with the landlord. We're currently gathering information from state trustees about what types of fees the clients living there are paying. Because as I said earlier, that can be an indicator of potentially an unregistered SRS. We will also be reaching out to the NDIS Commission and probably the NDIA to find out whether anyone in either of those houses are receiving NDIS supports, because if they are, then clearly they have a disability of some kind, and there's every chance that in fact it's not just a living arrangement, but in fact supports are being provided, that would provide us with, if we can't get consensual entry to the property, that would provide us with the basis to get a search warrant to search both properties. And that would help us establish whether or not it's an unregistered SOS.
So do you think there's only two, or do you think there's a lot more to find?
I think there could well be more, whether they're unregistered SOSs or whether they're Ndis or disability supports that have been initiated or established in the community where people are receiving Ndis supports but not necessarily paying funds from their personal income. That's what we need to work out. Yeah.
Presumably these pop-up residences find residences by either advertising or indicating in some way that they have a service to provide. You'd probably have a better idea of how they do that than we do. Do you interrogate those sources to see whether or not people are seeking residents and seeking to find residents and follow those up?
Typically how, I'm not, look, I could be wrong. I'm not aware that they do advertise per se often, because they're often very small companies that don't necessarily have a web presence or the like. There might be an individual person who thinks that it's okay to set up a support facility like that. Typically where we hear about them from is the issue that Council Assisting referred to earlier, where you might have in nominal Ndis provider approach, for example, an SRS, and encourage, induce a person to move into their accommodation that they run. Typically those types of concerns would be raised with us as a regulator, either by the proprietor or by people associated with the client. And that is normally then how we would work out that, or identify that in fact there's an issue there. The other piece of work would be contemplating, but it literally is in its infancy, is how you would compare data across local councils, the Ndis and NDIA, and our own data as to where are addresses where Ndis, for example, supports are being delivered into. So there's clearly someone with disability in those sites, and whether that raises alarm bells for whether it might in fact be some form of pop-up disability service.
Well, they're things you could do. I guess what I was asking you, do you do that? And are you following it up with staff?
At the moment, most of our effort is again responsive in relation to issues of concern that we hear, and sharing of information with the Ndis Commission or information from them to us and the NDIA. And certainly it's an issue that, as we hear about it more often, we are having to contemplate whether it's something we can actually proactively address.
So the short answer is no, you're not yet.
Not yet.
Right. That'll save a lot of trouble. You said that the NDIA gave you some information about the number of SRSs which have received payments for NDIS supports that are being delivered to someone living within the SRS. Would you be able to provide the Royal Commission with the numbers, not the obviously the details of the addresses, but the numbers of the 117 odd SRSs you've got that are in that situation that you would be monitoring? How many,
Well, again, I think if there's to be a request for further information, the appropriate course is for that to be done through Council Assisting and the token.
I was just asking whether he could.
Yeah, I know, but I think the better thing is for this to be done through Council Assisting.
And then finally, look, I think you have heard in the evidence before the Commission, we've had a number of SRS residents from a variety of different SRSs tell us that they've been routinely hungry, cold, and living in unhygienic conditions, one of which the resident told us that she was angry about those conditions. Would you say that the regulation activity that you're conducting overall is in any way sufficient to prevent those things from being almost routine in us SRSs, that people are hungry, cold, or living in putrid conditions?
Yes, I do think our regulation is effective in reducing that to a small number of SRSs.
What would you regard as a small number? Please let him finish. Yes, please go ahead. Finish your answer, please.
So, for example, the evidence given to date, so particularly in relation to, for example, in Hamilton House and Grace Manor and Sydenham Grace, that's 3 SRSs that we have then taken action against. We have been closely monitoring, but we'd also now have taken action against to close them down so that those proprietors are no longer in the field. As I said earlier, whenever we receive complaints and through both unannounced and announced inspections, we monitor generally the performance of SRSs. So I think the examples that have been given in evidence, I'm not sure we can necessarily assume that that's representative of all SRSs. I think the examples relate to the absolute worst of the SRSs that we have now removed from the sector.
So you're telling us that they're just a rogue few and everything else is fine?
I'm not necessarily saying everything else is fine, but I think that the conditions experienced, and unfortunately, the conditions that people experience in Hamilton House and at the other 2 SRSs, I think are far worse than what you would typically see in an SRS.
Thanks, Mr. Chair. Thank you. Commissioner Galbally, do you have any questions?
My first question is, why have the numbers of complex people in SRSs increased? Why are they now more complex, in your opinion?
This is going to be somewhat an anecdotal answer. My best guess would be that the NDIS has given people with a disability other options that prior to the NDIS they never had. And I think particularly disability providers who are able to provide supports to people with relatively low support needs have taken up that option, and people have been able to take up those supports in other settings. Similarly, the advent of my aged care and more flexible aged care supports, I think, has also reduced the number of people who are frail aged that have previously used SRSs, perhaps more so in the above pension sector, part of the sector, than in the pension level. So I think what that's meant is that the people primarily coming through are people referred from, and I know that referrals, I think, from hospitals are one of the main referrals, and from community mental health centres. So I think it's for people with those types of supports that perhaps aren't always picked up in some of those other settings, or people who just aren't eligible for some reason or another for those settings, are coming through into to SRSs. I think that's why that's happening.
Yeah, we won't go further on it, but it's surprising to me that if they're complex, they're not picked up under the NDIS if they're under 65, but we'll just leave that one. With paragraph 34 and the accommodation and personal support standards, do the authorised officers assess the SRSs according to these standards? And so do they talk to residents in doing that? Do they actually meet with residents in their visits and ask them about these standards, about, healthy food and fruit? We've heard this week about food, and you've made the point that that's restricted to a few, but are these checked thoroughly with residents across the SRSs?
There's a number of areas. Yes, in a word, yes. The standards are one of the main criteria that authorised officers would check when they go out to an SRS, because they're quite prescriptive about what's expected of the SRS. There's also other particular areas that, the ongoing support plans, medication, there's other areas that the authorised officers would check. Yes, they certainly, when they do visits, whether it's a proactive visit or an unannounced visit, they would certainly also speak to residents about their experience of living in the SRS.
So they'd ask, I'll leave it after this, but would they ask them about whether they're cold at night and cold on weekends because the heating's turned off? Like, would they ask specific questions, addressing some of the concerns Commissioner Ryan raised about making sure those issues are picked up and then reported on. And then would you demand compliance? So there is fruit and veg and it's warm on weekends and warm at night and clean sheets. And would that be something you would?
They're the
follow
types of
through?
conversations that, yeah, I would expect that authorised officers are having with clients in terms of what's, and again, what people's living experience of the SRS, what's their experience of living there, and across a range of areas, because that can also vary obviously from person to person. But that's the types of questions that I would expect authorised officers are putting to people in terms of their experience of living, and then matching that back to how does that relate to what we know, because the resident may not necessarily be aware of what the legislative obligations are. So we have to then match that back to those.
And their reports are written up. So
Yes.
their reports are thoroughly written up.
Absolutely. Yep.
Okay, thank you.
Section 79 and 80 of the Act contemplate that a proprietor can manage or control money of a resident with the written consent of the resident. Does the regulator keep track of what happens as far as control of money is concerned, how often it happens, and whether the SRS is complying with the requirement to keep records and so forth?
Yes, that's absolutely an area. Not many SRSs take that responsibility on because there is a fair bit of compliance requirements that comes with it. But it's absolutely an area because of the obvious risk involved in terms of handling people's money. I know for a fact that we just recently spent a significant amount of time in one SRS in regional Victoria where we specifically audited their management of clients' money, and that continues to be an ongoing issue. So yes, it's an area that because the Act is quite prescriptive about if you're going to manage a client's money, it needs to be with consent. There are reports you need to provide. So we would look at is that actually in place?
How do you determine whether the consent is informed?
That's a much trickier question. Yeah, usually that would be in conversation with the client, and or particularly if we've had concerns raised by a family of a client or an advocate. But that is absolutely or a trickier thing to sometimes pin down. Yeah.
On the face of it, it's a rather odd situation that a private corporation or individual running an SRS for profit and being paid by the resident has authority to control, that's the language of the Act, the resident's money. So you would think it's a situation fraught with potential for abuse.
I think it's certainly a situation that poses, if not monitored, that poses obvious risks. I agree. I presume the people, in the drafting of the Act, they envisage that there are a number of people who might, in fact, choose to live in an SRS or end up maybe not having many options as to where they live, who may end up living in an SRS, who actually do need support with the money in order to make the most of it. So I think it's probably envisaged that where they don't have an administrator or don't have a family member that can do that for them, that another fallback is the proprietor with requirements associated with that in terms of how they actually go about doing that.
Yes, thank you. All right. I take it there's nothing further at the moment. We're going to adjourn in a moment, or
Yes.
we're going to go straight into something else?
Yes, thank you, Chair. We do need to have a break. We've been imposing our interpreters quite enough today. So if we could have a few minutes and then before we finish the final witness.
Okay. All right. Well, in that case, thank you very much, Mr. Collins, for coming to the Commission to give evidence and for the detailed statement that you have provided. We appreciate the assistance you have afforded to the Royal Commission. We'll now take a break for 10 minutes? It's now 3 o'clock. We'll resume at 3.
Please, Chair.
The Royal Commission is adjourned. The Royal Commission is resumed.
Yes, Ms Bennett.
Thank you, Commissioners. The last witness today is Ms Sherry Brunhout.
Thank you very much, Ms Brunhout, for coming to the Royal Commission to give evidence all the way from Melbourne, I understand. If you would be good enough to follow the instructions of my associate who's located over there, he will administer the affirmation to you.
I will read you the affirmation. At the end, please say yes or I do. Do you solemnly and sincerely declare and affirm that the evidence which you shall give shall be the truth, the whole truth, and nothing but the truth?
Yes, I do.
Ms Brunhout, just so you know where everyone is located, Commissioner Galbally, whom you can see on the screen, is in Melbourne and is joining the hearing remotely. Commissioner Ryan is on my left. I'm the chair of the Royal Commission, and Ms Bennett, whom you can see, is senior counsel assisting, and I will now ask Ms Bennett to ask you some questions.
Thank you, Chair. And Ms Brunhout, you've made a statement to the Commission, is that right?
That's correct.
You've read that statement recently, and save for a cross-referencing error, the typographical nature in paragraph 85, is the contents of that statement true and correct?
Yes, it is.
Thank you. Ms Brunhout, can you tell the Commissioners your current role and where it sits within the department?
Sure. I'm the Executive Director of Homelessness and Housing Supports at Homes Victoria, which is a unit within the Department of Families, Fairness and Housing in Victorian State Government.
I'm now going to ask you some questions about pension level SRSs, and I'll use the shorthand SRS when I'm referring to that group of accommodation. You'd accept, Ms Brunhout, wouldn't you, that SRSs continue to accept high levels of referrals from acute health and mental health sectors, as well as from homelessness services?
Yes, they do.
That's one of the main contributing factors to the population of people presently resident in SRSs.
To people currently being accepted into SRSs,
Yes.
I would say, though, that there are some long-term residents in SRSs that perhaps haven't come from those pathways.
Yes, but the needs of SRS residents are becoming increasingly complex, is that right?
Yes, in line with, as we're seeing more complexity across a lot of human services, yes.
Yes, and that adds to the financial and staffing pressures on SRS proprietors, is that right?
I would agree with that.
And in the absence of additional income to support residents, their increasingly complex needs threatens the viability of SRSs and impacts outcomes for residents. Do you agree with that?
So let me just say that back to you. So the increasing complexity has an impact on revenue and staffing.
It adds to the financial and staffing pressures that are on SRS proprietors. Do you agree with that?
Yes, I do.
And in the absence of additional supports, the increasing complexity of needs threatens both the SRS's ongoing viability. Do you agree with that?
Yes.
And it impacts on the outcomes for residents. Is that right?
Yes, I would agree with that.
And by the outcomes for residents, you mean the level of services and the safety of the residents themselves?
I would say the care that's appropriate to meet their individual needs.
That is what is being impacted upon.
Correct.
The level of care is being reduced.
Potentially, yes.
Now, you'd agree that the majority of SRSs rely on government subsidy assistance. Is that right?
It depends what you call government subsidy assistance. They take their revenue from particular people that are predominantly receiving a subsidised income from government, but also most pension level SRSs receive some sort of government subsidy as well.
And would you accept that the majority of SRSs, pension level SRSs, would not be viable without that government assistance?
Yes.
And those subsidies are inconsistently applied at the moment, is that right?
I wouldn't say inconsistent. They're consistently applied within the policies that have been established, and they're consistently applied across 2 different programs. So within the guidelines of those 2 programs, they're applied. The 2 programs are different.
Yes. Would you agree that the subsidies are inconsistently applied based on historical decisions that have been made by the department over time?
I'd say that they're consistently applied as per the program guidelines as they was established.
I see.
At the time.
Um,
I'm not trying to be irritating. I think that it's a distinction from what you're
I
proposing.
might return to that. The effect, though, of the way in which government subsidies are provided is that the funding available is not efficiently or effectively distributed to ensure the optimal impact on SRS viability. Do you agree with that?
No.
Okay, could I take you to your document, which is at Vic? I won't ask you to, so I won't bring it up on the screen. This is the project request for the Nous Group dated 8 April 2022. Do you have that with you?
I do.
Could you go to page 2? Can you see the paragraph there starting with the words "the majority of SRS rely"?
Yes.
Can you read that paragraph to yourself? Well, I'll read you the second. I'll read you the paragraph. The majority of SRS rely on this government subsidy assistance, an average of $137,000 each SRS per annum, to be financially viable. In the context of government investment in housing assistance, these subsidies are inconsistently applied based on historical decisions. This means that funding available is not efficiently and effectively distributed to ensure optimal impact on SRS viability. That's your document, isn't it?
That is my document.
It's recently written.
Yes, it is.
It's accurate, isn't it?
Within the context that this document was written, it's accurate.
Yes, and your previous answer to that extent was not accurate.
No, I would say if we're talking about broad statements regarding SRS, this is a document that looks particularly at the viability and a cost-benefit analysis of the funding decisions and the funding guidelines as they stand for 2 programs. The previous comments about have the guidelines been, or has the funding been distributed consistently? I still stand by my statement that they were consistently delivered at the guidelines.
No, I was on to the next point, which is that the funding available is not efficiently and effectively distributed to ensure the optimal impact on SRS viability. You'd agree that's the case?
Ms. Bennett, perhaps just a little.
I'm sorry, Chair. You'd agree that's the case, wouldn't you?
In the context of doing a financial impact statement, absolutely, yes.
Yes. The department continues to identify market trends and risks within the sector that impact on outcomes for residents. You agree with that?
Are you still reading?
Well, I'm just asking you the question. Has the department been identifying market trends and risks within the sector that impact on outcomes for residents?
That's correct, but within the scope of, are we still talking about this document?
I'm just asking you the question more broadly. I'm just asking the question, is the department aware that there are market trends and risks within that sector that impact on residents?
Yes.
And when we're talking about impact on residents there, we're talking about the impact on the standards of care that they receive in the SRS environment.
To meet their individual needs, yes.
So those are risks to people in that environment.
They can be risks, yes.
Yes, and the people within that environment, for those receiving SAVI funding or PLP funding, they are 93% and 95% respectively people with a disability. Is that right?
That sounds about right, yes.
Well,
I can.
It's in your statement, but yes, that's close enough. Is that fair? Right. Yes. There have been an acceleration of closures in the SRS sector. Is that right?
That's right.
And that's because of the non-viability of the SRS model as it presently stands in the pension level. Is that right?
Oh, there's a few drivers for that, but you could summarise it as being a viability issue. Yes.
And that has created what you describe in this document as a complex risk matrix of issues evolving within the SRS sector that has created a high risk environment to government, including high profile cases of regulatory non-compliance, a lack of service coordination and support contributing to poor resident outcomes, and costs associated with relocating an escalating number of complex residents as a result of increasing market failure. That's what you've written in the document, and that's your experience, isn't it?
Yes, that has been the case in a small number of SRSs, yeah.
What is the risk to government?
Government has an obligation, as you've heard from Mr. Colmas, in terms of a regulatory oversight, but that's not in scope for this document. The risk to government is that at the moment, pension level SRSs can accommodate up to 4,000 quite vulnerable Victorians. There is a risk to government that those vulnerable Victorians need adequate care to meet their needs. There is also a risk that that the viability of this sector would need to be met by other means should this sector be not continued.
Is the risk to government that it will have to provide for the some 4,000 people if this sector doesn't continue?
That could be a risk to government.
Is the government propping up this sector for that reason?
I wouldn't characterise it that way, Ms. Bevan.
The risk to this document refers to towards the end of that paragraph, a lack of service coordination and support contributing to poor resident outcomes. Again, can we take that to be a reference to reduced resident support?
When we're talking about coordinated support, we're talking about a changed environment where NDIS, aged care packages, mental health recommissioning, but this is a changed environment where being able to ensure that those supports are coordinated for residents to have the best outcome.
Isn't the greatest risk here to the residents, not to the government?
And I think you'll see, to be fair, through this document, that is at the centre of...
That's my question, though. That's the key risk here, isn't it?
It should be, yes.
Yes, it is the key risk, isn't it?
Yes.
Now, you say on the following page that the rapidly increasing rate of voluntary and involuntary closures of SRS indicate that the current funding model is unsustainable and putting vulnerable people at risk, further compounded by a tight property market and poor availability of private market housing. So is it the position of you and your department that this model is not viable as it presently stands?
My view is that it would be very difficult for a pension level SRS to be viable without some form of government subsidy. And I think it would be fair to say that government is sufficiently concerned about that to have commissioned this review to look at exactly those issues.
So what is the present plan to meet that risk that is presented by the rapidly increasing rate of voluntary and involuntary closures?
So it's a very big question, Bennett. So we're looking at this review to ensure that the $13 odd million that is currently spent in pension level SRSs is used to the best effect to support outcomes for vulnerable Victorians. It also sits within a range of government initiatives over the last couple of years that looks at housing stress in Victoria and looks at the availability of community and social housing in Victoria and public housing in Victoria that sits within a suite of broader reform initiatives to address housing shortages.
Is Victoria the provider of last resort for people with disability, a housing provider of last resort for people with disability in Victoria?
When you say is Victoria a provider?
Is the state.
The state of Victoria.
Yeah, is it?
The provider of last resort.
Yeah.
I'm not sure what you mean.
Well, if a person has been evicted from an SRS, they have a disability and there's nowhere else to go, does the state step in?
If someone's experiencing homelessness in Victoria, then there is the specialist homelessness sector, which the Commissioners heard about earlier this week, absolutely steps in to provide assistance to people experiencing homelessness.
Yes, and so is there an expectation that SRSs will be providing that support instead of the state, or is the SRSs, sorry, let me go back. Are the SRSs the step before the state will intervene to protect people at risk of homelessness?
I don't think that's a fair characterisation. I think that there's a continuum of housing responses for vulnerable Victorians. Some of those have, for people who require support, some of them are independent housing options that have carers come in and out, and some are supported residential services, and SRS is one of those housing options.
So of the housing options that provide support, the state provides SDA housing, or what housing is provided with support for people with disability?
SDA and other NDIS funded accommodation. There's also, the Commissioners heard earlier this week about other housing first type models, particularly for people with disability. You heard Wintringham talking this week about some of their common ground style models of accommodation. So there's a variety of options that are available. Are they enough to meet everyone's needs? Probably not, but there are a variety of options.
I see. Excuse me for 1 minute. Commissioners, in light of the time, those are the questions that I have for Ms. Grunhout, and the Commissioners may have some questions that I...
Very good.
Please, Commissioner.
Commissioner Galbally, do you have any questions?
My question is around the SRS model that I'm very struck, and I just want to check if I'm correct, but there doesn't appear to be any capacity building or developmental function in living. Like, you can't cook, you can't even eat between meals and afternoon tea, so you can't even use your own judgment to select something to eat. You know, you have somebody to change your bed. Are you given assistance to learn how to do that? Like, I'm just sort of, it seems people are there and there's no sort of vision for where they might be. So there's no sense of interim even about them. But I might be wrong about that. That's what I've picked up, that there's just no development coming from them.
Commissioner Galbay, I think SRSs are a pretty broad church, and I think the service or practice model, I think there's 114 SRSs across Victoria. There's probably about 114 different service models. In some SRSs, food is readily available. Snacks, fruit bowls are available to residents between structured meal times. In other SRSs, you'll see as an attachment in my statement, there's a few $1 million a year going to support coordination functions. They can run activity groups within the SRSs. So they're health practitioners and social workers. So they go in and they run living skills activities, and they run excursions, they go fishing, they do all kinds of those sort of activities. So by and large, yes, that they are a facility for people who need daily support care. But I think that to say that there would be no sort of living skills enhancement or development wouldn't be true across the board.
Would you pick up which ones do have, you know, quite a commitment to improving daily living skills, you know, self-care? Yeah. And I would very much like to see those reports, but I'll leave that again,
sure.
Of course. Thank you.
I think Commissioner Galbally means she'll leave that to Council Assisting. Thank you. Commissioner Ryan.
Could I ask some questions about the proposed review, or the review that's underway by the Nous group?
Sure.
You've indicated some of the lines of inquiry.
Yeah.
One of the lines of inquiry doesn't seem to include compliance with the Convention on the Rights of People with Disability. I mean, there are plenty of people who would suggest that because people don't have choice of who they live with, and that creates problems for people, and they don't have sufficient choice and control in how they run their lives, that they're segregated from the community, that that model does not comply with the Convention on the Rights of People with Disability. Shouldn't that be one of the lines of inquiry as well?
Yes, in Victoria, all of the programmatic funding and guideline has to comply with the Victorian Charter of Human Rights, which is, has very similar conventions. So yes. In any review and any changes that might be recommended to the SABI or PLP program, we would have to comply. I think it's interesting though to be thinking about how we use government funding to bring that sort of client-centred experience into SRSs as much as we can. So putting aside the regulatory aspect, but really investing in being able to, so for example, some of that funding can be used for what's called a single room supplement. So people who aren't able to share with other people, but where there might only be a twin room available.
But because you've said that you've already provided that to them, I would recommend that you say that as well. Because just say, look, I have to reveal my source, but I've also said
I think we've got interference from the rest of the hotel.
Was having.
However, I did hear what you said.
Great. So it seems to have resolved.
I can keep going, but if that answers your concern about the charter.
I'm still not clear whether the Convention on the Rights of People with Disability is a critical part of that review. Compliance with that is a critical part of the review.
It's not an explicit part of the review, but any action that we take as a result of the review would have to be in line with the charter.
Why? If it's not an explicit part of the review.
So the review is to bring recommendations to government. Any implementation of changes, because we're a government department, has to be compliant with the Victorian Charter of Human Rights.
Okay, you've given details of who the stakeholders that have been consulted.
Sure.
And they range from SRS providers, partnership managers, supporting connections workers, human service regulator staff, community visitors, area mental health staff, and homeless services workers. There's a group of people pretty much missing from that, isn't there?
Wow.
People with disabilities, advocacy organisations and so forth. Is there any attempt to make sure that there's a broader consultation on that? Residents of SRSs, for example?
Yeah, no, thank you for asking. At the time that we wrote that, we didn't have ethics clearance, so it wasn't included. It has subsequently been included. With the Nous group, who is commissioned to undertake the review for us, has been talking to both present and past residents. They've also interviewed Dr. Pearce, who you heard from yesterday, the community visitors programs, as well as 2 other advocacy groups. And also, thank you very much, using the lived experience from this commission as feeding into the review as well.
Is there any option for public submissions to this review?
Not at this point in time.
Would that be a good idea?
It would be something I'd be happy to consider.
Thank you, Mr. Chairman.
Thank you. Do SRSs have any equivalent in any other Australian jurisdiction, to your knowledge?
Well, it's a bit out of my remit. I'm not entirely sure. I mean, we heard from Mr. Lippman yesterday that generally where there's a gap in the market fills a gap. So it would not be a surprise to me to learn that there are other SRS style facilities in other jurisdictions.
What underlies that question is really what led to them in the first place and how they've survived in the current environment, which has been radically altered by the introduction of the NDIS.
So, Chair, the SRSs kind of existed as a bit like room and board. And then in the 80s with deinstitutionalisation, they became a much more sort of supported room and board, if you like, and then led into being a supported residential service. and they sort of plateaued a little bit, and they had a fairly structured business model and a fairly structured, to Commissioner Galbady's point earlier, sort of fairly structured support model and practice model. We've seen that fundamentally change over the last probably 10, 15 years, 10, 12 years, as the affordability of housing has become more and more difficult, and different support models giving much more choice and control of, instead of those sort of large congregate settings. So we're really seeing what was quite a stable private for-profit business sector now undertaking some pretty radical change.
Your statement provides a very comprehensive account of the multiple pieces of legislation in Victoria that might be relevant to accommodation for people with disability. What's the difference between a rooming house under the Rooming House Operations Act and an SRS?
Yeah, it's interesting, isn't it? So a rooming house is where there's 4 or more bedroom or 4 or more separate tenancies that are occupied on a property, and it's covered by the Rooming House Act, and there's tenancy rights. An SRS, you enter into an accommodation and support fee structure. So, sorry
to interrupt. So that includes not just the accommodation, but some support services.
So SRS is you give a fee in return for accommodation and a support plan.
So what's the difference between that and an SRS?
So that's what I'm saying an SRS is. So I beg your pardon. So a rooming house, you just have a tenancy agreement.
It's just the accommodation. There's nothing, I take it, to prevent the rooming house operator becoming an unregistered NDIS provider and providing services to one of the tenants who is occupying the rooming house.
Well, that's when it gets into Mr. Colmus's area to determine whether or not that is a accommodation and support for a fee, or if that is a rooming house with a separate support arrangement, supported independent living, for example.
But it shows that the boundaries are a bit porous, doesn't it?
Chair, I think that there are opportunities for improvement in that area.
Yeah. All right. Well, thank you very much, Ms. Brunhout, for coming to the Commission and giving evidence and for your statement. We appreciate your assistance. Thank you.
Thank you.
If you'd like to step down, that's fine.
Thank you.
Yes, Ms. Bennett. I take it there are some directions.
Yes, Commissioner.
And have they been circulated to parties who have been given leave?
Yes, Commissioner, and we've
here, and nobody has expressed any profound disagreement?
No profound disagreement, Chair.
In that case, I'll read the directions that are proposed, and if any representative has any objection to any part of it, they can indicate. Otherwise, I will make the directions that I read out. The proposed directions are as follows. 1, any witness who took questions on notice during this hearing should provide his or her answers in writing to the Office of the Solicitor assisting the Royal Commission by 30 September 2022. The answers should be targeted and concise and not address additional or unnecessary matters. Counsel assisting the Royal Commission may tender those responses into evidence. 2, by 14 October 2022, counsel assisting the Royal Commission will provide a list of documents, all documents she wishes to tender into evidence, including responses to questions on notice on a confidential basis to the parties with leave to appear at this hearing. 3, parties with leave to appear should advise the Office of the Solicitor assisting by 21 October 2022 if they wish to suggest any additional documents for tendering by counsel assisting. At the same time, they should identify any parts of the documents to be tendered that they consider need to be removed before the documents are made public with reasons. 4, counsel assisting will tender those documents into evidence which she considers appropriate and will do so in chambers by 28 October 2022. 5, counsel assisting the Royal Commission will prepare written submissions following the hearing. By 4 November 2022, these submissions will be provided on a confidential basis to parties with leave to appear and may be provided on the same basis to any witness or recipient of a procedural fairness letter from the Office of Solicitor assisting the Royal Commission in preparation for this hearing. 6, any responses to counsel assisting submissions should be sent to the Office of the Solicitor assisting by 2 December 2022. Those responses should be concise and should not include any additional evidence. In the absence of any disagreement with those directions, they are the directions that I make. Ms. Bennett, is there anything else from you?
Only to thank the legal representatives for the parties and those who have appeared this week for their assistance. Otherwise, we have nothing further for commissioners.
All right, thank you. Thank you very much. I should make this statement about protection of witnesses in order that it be reinforced. The Royal Commission has been very greatly assisted at this and previous hearings by evidence from people with lived experience of disability. Hearing evidence from people with disability is essential if we are to understand fully the issues that are the subject of our inquiry. We continue to encourage members of the public to come forward and share their stories. In our engagement with various members of the public, a number have expressed concerns about being identified and the potential effect talking with the Royal Commission may have on them. I would like to remind everybody who is following the Royal Commission in one form or another that under Section 6, capital M of the Royal Commissions Act, it is a criminal offence for any person to cause or inflict any violence, punishment, damage, loss, or disadvantage to any person for or on account of reasons that include the person having given evidence to the Royal Commission. It is important to appreciate that the Royal Commission will, if necessary, take steps within its powers to ensure that witnesses and those engaging with us are protected in accordance with the Royal Commissions Act or indeed the common law. I won't take up any significant additional time in concluding this hearing, but I do want to express the thanks of the commissioners to all those from the Royal Commission and who are assisting the Royal Commission in the preparation for and the conduct of this hearing. As I have remarked on many previous occasions, these hearings are extraordinarily complex to organise, to prepare for and to conduct. And we are always grateful for the extraordinary support we receive from staff and others who've been involved in preparation for and conduct of the hearing. It obviously would not be possible to conduct these hearings without that support and assistance and the great skill and dedication that are shown by the members of staff and others who contribute. I mentioned particularly the Office of Solicitor assisting, all those within the Royal Commission who have been responsible for the logistics and organising the hearing, which is a process of considerable complexity, to the staff from the policy team who have helped prepare for the hearing and to inform the hearing and to enable it to be conducted as efficiently and as effectively as it has been, to the counsellors who provide invaluable support to the people with lived experience of disability from whom we have heard this week. Their role, which is behind the scenes, is nonetheless of critical importance to the conduct of these hearings. We could not hear from people with disability about their own experiences without the support that they receive from the counsellors who show enormous skill and empathy in providing that support. We express our appreciation, as always, to the Auslan interpreters. On the whole, the average speed of talking in this hearing hasn't been quite as extreme as in other hearings, but still they operate with remarkable efficiency in translating the spoken word into Auslan. To Law and Order, the people who provide the IT support that enable us to operate in this way, our thanks as always, and to the staff who provide support to the commissioners, thank you too for the work that you do and the support that you provided. And of course, to the official secretary, who is the eminence grise behind the entire operation. I do want to express our particular appreciation to the witnesses who have appeared, who have lived experience. I refer to Charlotte, to Dawn, to Jack, who I see is here again today, Colin, Nick Morehouse, Claudia, Jacob, Belle, Georgia Wilson, and to the witnesses who gave evidence via pre-record, Christmas, William, Dave, Denise. This hearing has been quite extraordinary for the evidence that has been given by the witnesses who have lived experience of homelessness or have had experience of being under threat of homelessness, and the evidence that they have given to the hearing is of the utmost importance to the work that we now have to do in compiling the record of their experiences and in formulating recommendations to be included in the final report. We are deeply grateful to them for having given their evidence. We know that it's not particularly an easy thing to do, and we hope that the experience of giving evidence has been something that they can take considerable pride in, and that has been something that they will look back on as a very worthwhile exercise from their point of view. I do want also to express appreciation to the various witnesses from a variety of sources who have given evidence to us during the course of the week, and for the very detailed statements that have been provided. That material is, of course, of extreme importance to our work. It provides the basis for understanding how the various systems that we're looking at actually work in practice, and what perhaps needs to be done in order to fulfill, or so that we can make recommendations that fulfill our terms of reference, which, as you know, concentrate on the need to protect people with disability from violence, abuse, neglect, and exploitation, and that can lead to a more inclusive society that minimises the prospect of any such abuse, violence, neglect, or exploitation occurring. So our thanks to everybody who has given evidence, everybody who has participated in the preparation for and conduct of the hearing. We are indeed most grateful to all of you. The next hearing will take place in Perth. This will be public hearing 27, and it will deal with issues involving the experiences of people with disability in the criminal justice system, with particular reference to circumstances in Western Australia, but perhaps not exclusively to circumstances in Western Australia. So we shall now adjourn, and the Commission will resume with public hearing 27, which is to start, as I recall, on the 17th of September. Is that right? 17th, I think, yes.
19th.
Sorry?
19th.
19th of September. All right, don't rush to Perth until the 19th of September. Okay, we'll now adjourn.
The Royal Commission into Violence, Abuse, Neglect and Exploitation of People with Disability is adjourned.